Hooray.
Okay, we are live on YouTube, recording and ready to go.
Great, thanks, John. Wade, can you start us off with roll call, please?
Thank you. Mr. Badger.
Here.
Mr. Bleefeld.
Here.
Mr. Frank.
Here.
Mrs. Ginsburg. Mrs. Heyman.
Here.
Mrs. Karyonikis.
Here.
Mr. Stoloff.
Here.
Mrs. Welsh.
Here.
Mr. Antonio.
Here.
Paige Benning.
Here.
Alex Skindia.
Here.
All right. 8 board members present, 1 absent, and 2 student board representatives attending as well. No solicitor. Thank you.
Okay, thank you. It's time for the Pledge of Allegiance. And John, maybe you could display our flag, and other board members, please unmute so I'm not saying the pledge alone. John? Oh, here we go. All right. I pledge allegiance,
I pledge allegiance to the flag
of the United States
of America
and
and to the republic
which
which it stands,
one nation, under
God,
indivisible,
indivisible, liberty and justice for all.
Thank you. I don't think I'll ever get used to doing that over Zoom. But anyway, I'd like to welcome everyone to the August 6th, 2020 special meeting of the Wissahickon School District's Board of Directors. We convened this meeting at the request of the superintendent, who has important updates for us and which will also require board action in order to move forward. So with that, just quickly in our agenda, item 2, we have a list of prior meetings in the month of July. And item 3 lists upcoming meetings through August and into September. And then we're going to go right into presentations, which I'll hand off to Jim. The first one is going to be concerning our fall reopening teaching and learning plan. Jim?
Okay, thank you, Joe. Yes, so this topic is back with us. We have a fall reopening teaching and learning plan in place now. It was approved, and since the time it was approved by the board, there's been some developments that have made me change my recommendation from the previous plan to a 100% virtual plan for all students. And before we get into the presentation, Gary's got a few slides to talk about what that might look like and to share some data. We surveyed both parents and staff, and we will share that out in a minute as well. I just wanted to set the stage a little bit, in a sense, paint a picture as to why the change in really not much time since the first plan was approved. What I feel like we're running into here is a feasibility problem. I'm having major reservations about our ability to staff the schools on a daily basis reliably and safely. It has to do with all the other districts in the area, and Gary will speak to that as to how many are 100% virtual. It has to do with that because indeed our staff have now reported a significant increase in conflicts in the home front and their ability to get into school. But it's not really just that. There's this increased uncertainty about what a normal school day will look like now that we have so much staffing uncertainty. So I'll just going to share one example just to illustrate. We have had kindergarten screenings going on the past few weeks. And just the other day, one of our kindergarten teachers got home to find that her child had a fever. No idea if it's COVID yet because there's no testing available that can rapid turnaround. The county testing is 5 to 7 day turnaround now. So we spoke about it with her, and she's nervous, and so she's going to stay home. Now she's going to stay home not because she has to quarantine, because remember that doesn't happen until somebody tests positive, but she has to stay home to take care of her kid. So I'm picturing what a day would look like when, on a normal day anyway, there's a mad scramble for covering classes and finding the subs and figuring out who's doing what. And with this increased staff uncertainty, with the inability to turn around tests in any short period of time, with the need to quarantine, I just feel like it's going to be a kind of a fool's errand to try to suggest that the schools can be staffed safely every day. Some days they can. On the day where the nurse can't come in, and we always have trouble finding sub nurses anyway. And I don't have any data to show that we'll have more or less trouble now, but we can all surmise, I think safely, that there will be fewer nurses available. I can only imagine what that school day would look like when there's not a nurse now. And by law, you're allowed to have a nurse cover 2 buildings. And sometimes we do that in a pinch. We try to not do that if we can help it, but so I'm matching that together with just the normal. If we get that kindergarten teacher, let's say we do find a sub for her, and let's just say it's day 6 of the school year. That sub is not going to be experienced with our mask protocols, face covering protocols, not going to know what to do when somebody has a temperature, may or may not know what to do about all the new intricacies that would be required to conduct school safely. So who's going to help that sub? Well, it would be the principal's job to train the sub, which they normally do. But then there's going to be 6 subs. Where are the subs going to come from, and how are we going to train them? It just paints a picture of a feasibility gap in a sense. There's been recent experiences since in the last couple of weeks of other places that try to open school, be it Indiana or Georgia, other countries, Australia, tried to open up and then actually shut down rather severely immediately thereafter. This is new information. That's not to say it would necessarily happen here, and I have no data to suggest that it would or would not happen here. It's just examples that are adding to the feasibility gap here. We did have, as I mentioned, we have the survey that, and Kathy can expand on that a little bit in terms of not only how, Gary will show how many staff members responded to the survey in what way, and then Kath can expand on the number of people who have called her with specific concerns. But I think in conclusion, I'm gonna hand over to Gary. It just felt like it was time to let safety drive. It just felt that way to me. And I felt like we were trying to ram through something where and the more we thought about it and the testing and the staff availability and everything else, the more it felt like it's time to do this now. Give people plenty of time to plan either on the home front or in the classroom. And none of these COVID time options are going to be optimal teaching and learning. It's just not going to be optimal. It's not going to be optimal virtually. It's not going to be optimal hybrid, and it's not going to be optimal in person. Rows of desks of 6-year-olds with masks on. I mean, that would have, okay. And then there's definitely advantages to having students in person. I get that. But in terms of teaching and learning, it was just not going to be optimal no matter which way we went. And so I think it's time to have safety drive and do this now, get it right, and dedicate ourselves to making it right. So with that, I want to pass it over to Gary, who's got some things to say about what it might look like, as well as the survey results. Gary?
Okay, so I'll begin with the survey results just to kind of share that information first. All right, is everyone able to see that?
Yeah.
Okay.
All
right, so
Gary and Jim, last I checked, the agenda that's publicly available on the district website did not include this presentation material. Can someone make sure that that stuff is posted now?
We're doing that as soon as we can, yes.
Or go ahead, Gary.
Yes. So there were 3 surveys that were administered in the last 3 weeks from parents about their interest in having students attend school in person or to attend school virtually. And so I have that information. I also have the information on staff that was done the last week of July, and also a recent staff in a survey that was completed this week between August 4th and today, August 6th. Actually, it was on Friday, it was due in. All right, so we're going to start with the parent guardian survey results. And again, this was parents making a choice between a virtual program option for their child as opposed to coming in the live 100% elementary program, or at secondary level, choosing between coming in, again, some students coming in alternating days, and students in the virtual choice attending the virtual academy, Wissahickon Virtual Academy. Survey window was July 23rd through the 31st, and we had about 1,500 responses to the survey. This just gives you a picture of the 15-16 responding, which is 31% of the district's families or students, and then the distribution of responses according to school. And so 21% of the respondents here for Wissahickon High School, 25% for Wissahickon Middle School, basically giving you the distribution there. All right, and then in the breakdown by schools, high school had 314 students whose families selected the virtual option, the academy. 7th and 8th grade parents, there were 167 who chose the academy option. There were in the 6th grade, which remember would be a Wissahickon teacher doing this as a live synchronous teaching, 118 parents chose that. And in K-5, there were a total of 917 families who opted for a virtual Wissahickon teacher to be in a Wissahickon virtual class with that teacher. So we had, I mean, if we just go back for a second, essentially we had, sorry, let's go back one. Essentially, we had about 30% of our student population, if you blend it all together, about 30% of the students who are choosing a virtual option as opposed to coming into school, the brick and mortar classroom.
Hey, Gary, just to clarify.
Yeah.
If you didn't respond, we're assuming that you are, like the default is that you are going into the hybrid or in-person option.
That is correct.
Right, okay.
Yep. All right. Then on July 28th to July 31st, our first staff survey, we had 487 responses to the questions that I'll share with you. And this gave you a sense of where the staff was on that particular date. Just a little over a week later, the second set of results, which I'll share with you, show some of their thinking now, closer to this point. So in the first one, there were, as I said, 487 responses. The number of responses by school here first, and then this is the percentage of respondents to the survey. This is not 9.86% of the school, but it's 9.86% of the respondents to the survey. All right, that gives you a sense of the distribution across the schools. This particular slide wanted to know, do you have a documented medical condition that would prevent you from returning to in-school instruction, in-person attendance? If yes, you will be asked to provide documentation from your physician. And we had 485 responses to this, of which 35 of those responding said they did have such a medical condition. 450 said they did not. So the next question, do you have a child who is unable to attend school and or go to childcare due to a COVID-related reason? 57 responded yes, 430 responded no. Do you reside with any person who has a documented medical condition which places him or her at greater risk from COVID-19? This is for informational purposes only. Residing with an individual at greater risk is not a reason for exclusion from in-person work under the law. 104 people responded yes, that was their situation. 384 responded no. Are you requesting to teach work in a virtual way instead of your in-person assignment. Again, your response does not commit you to teaching virtually, nor does it guarantee a virtual spot will be available for you. 105 responses were saying yes, they would choose the virtual work setting. 380 responses were no, they would be not asking for that. Then fast forward to this most recent one, August 4th through August 6th. Response total 541. This divides it into certificated staff and supported staff. So you see the difference between the two. There were 540 respondents altogether. 390 of the respondents were professional certification people, and 151 responses were non-certificated staff. This gives you the breakdown around the buildings in terms of how many, what percentage of the respondents came from each of the schools. Certified staff, do you have a child who is unable to attend school and or go to childcare due to a COVID-related reason? This was 93 responses saying yes and 296 responses no. Are you requesting to teach or work virtually instead of your in-person assignment? 171 responses yes, 219 responses no. In terms of our support staff, same two questions. Do you have a child who is unable to attend school and or go to childcare due to a COVID-related reason? 14 said yes, 135 said no. And are you requesting to teach or work virtually instead of your in-person assignment? 44 said yes, 103 said no. That just gives you a sense of the, first of all, the parent choice of virtual as an option back in the end of July. It gives you a sense of where the staff is from the first survey to the second. And then the final piece that I wanted to share was just what's happening in other districts in Montgomery County. And this has been something we continually watching. So there were three options that were presented: blended reopening, a combination of either live and virtual, total remote or virtual learning, and undecided at the point as late as today. So you can see from this that there are some districts that are in the undecided column: Colonial, Jenkintown, Lower Moreland, Wissahickon, North Monco Technical Career Center. Total remote learning is 3, 6, 9, 10, 13, about 15 or 16 of the districts are in that position now, many of whom have changed from a previous approved version into the model that they've now gone remote quite recently. And then we have 4 districts that are listed as blended reopening: School District of Springfield Township, Souderton District, and Central Monco Technical High School, and Western Monco Technical Career Center. So this just gives you a flavor for where the county, all the districts are in the county at this current time. And that's the end of that piece of information. Are there any questions or comments on the survey information?
Plenty. Someone want to start?
Sure, I can start. All right, so I have a little thing I want to read first. For those of you that don't know me, my name's Tracy Walsh. A little background about myself: I'm a real estate agent and an administrator. Those are the jobs that pay me. I ran for school board director 7 years ago because I wanted to make a difference, to make our school district a better place. I put in countless hours and sat through numerous meetings. The reason for this little speech is that I wanted to express my feelings. I am appalled with our federal and state governments, the governor and the president. I will say this again: I am a realtor. Why are politicians in a higher position with access to data, medical doctors, psychologists, immunologists, etc., asking a realtor to make this decision? Why do we receive no guidance or assistance? I am appalled that every one of them wanted to pass the buck because God forbid they be held responsible for their decisions. The burden that this has put on these 9 unpaid board members is ridiculous and outrageous. Yet here we are. These decisions should have been made by our state and federal governments. Instead, they have left school boards across the country scrambling to figure out a safe and reasonable plan for school reopenings. With that being said, here are some points that I'd like to make. Today, I called 10 daycare centers in the area. There have been 0 cases of COVID at any of those locations. Schools opening around us in person or hybrid, other than the list that Gary just presented, and some of them are Bucks County, but they are close. Council Rock, O&J Roberts, Central Bucks, GA, Gwinnett Mercy, The Mount, Our Lord of Mercy, the Archdiocese of Philadelphia, the secondary schools, so like Lansdale Catholic, those types of schools, Radnor School District, Tredyffrin Easttown, and Tredyffrin is actually starting virtual, but then they're adding their hybrid options starting September 1st so that they can make sure that they have everything in place. The American Pediatric Association, New England Journal of Medicine, and Dr. Fauci, our leading immunologists, all suggest opening schools, but with precautions put in place. The Montgomery County positivity rate as of yesterday was 2.5. I couldn't pull it up today, but 2.5. And just as a side note, O&J Roberts and The Mount are both doing hybrid using cameras in their classroom. So even on the odd days when students are home, they're able to access class through Google Meet. This allows students that may need to quarantine to be part of the class. It also allows students that want the virtual option to participate in their class. This can be done and is being done. Also, with more schools that are going virtual, there will be more subs available. There will also be more school nurses available. We could hire long-term sub nurses that could have 3 or 6 month contracts to make sure that we are able to have nurses in our buildings. That's all that I wanted to say for right now.
So, look, I think I can speak for the entire board is that we didn't want another meeting to have to hash this out again. We spent, I think it was actually 10 plus hours on Zoom at these board meetings. It felt like 10 years, but it was plenty of time discussing and debating this topic, which culminated 2 weeks ago in a consensus vote, 6-3, to approve a hybrid opening plan that was recommended by Jim and Gary. And that sort of closed the issue in my mind. Now, we are here again because Jim felt that circumstances warranted him reversing course and having us considering a change in school reopening plans. But what I've heard so far, and my focus has really been on what's changed between when we voted 2 weeks ago and where we are today. And what I've heard is not a lot of solid data or evidence supporting a pretty dramatic and a complete 180 shift in what we voted on after hours of deliberation and discussion just 2 weeks ago. I mean, the staffing uncertainty is a real concern and a real problem. And if we didn't have teachers, it's like not having enough gas in the car to drive it. So I get that. But the sense that there is actually a staffing shortage that's going to happen, I don't think the evidence, the data supports that. I mean, again, it could happen, but I don't think speculating that it might happen is enough to completely reverse course, given what we went through a couple weeks ago. Data that other districts are, and more districts around us are going 100% virtual is a data point, but there's no like digging or analysis as to why that's happening. I haven't done that deep digging or analysis myself, but I did take a closer look at what happened in Upper Dublin, which is listed on Gary's chart. as going 100% virtual. In Upper Dublin, the administration's original recommendation was a hybrid plan. There was pushback from the board, and after a lot of discussion and debate, they ended up agreeing to start the year virtual, and then after the first marking period, to go hybrid. So it's really, rather than thinking of it as 100% virtual, to me, that's more of a delayed hybrid, because it's not a decision point. As we get closer to the end of the first market period, we are going to determine if it's safe to go hybrid. The plan is virtual start, switch to hybrid after first market period. So, and what I wonder in some of those other cases, is it a more nuanced picture than we're 100% virtual versus blended or not? And as to Tracy's point, if I wanted to specifically cherry pick schools that would support hybrid or even in-person learning, I could look around the region, and there are a number of districts that I could pluck and say, look, these guys are going in-person, hybrid, everyone's doing it, we should do it. So again, that argument that everyone else is doing it doesn't seem that legitimate or that strong to me either. The survey results we looked at showed that there was significant interest in a hybrid option at K-5. 60% of the parents, in essence, are choosing the hybrid, or actually it's an in-person option at K-5, and significant percentages in the neighborhood of like 70, 75% are choosing the in-person hybrid at the middle and high school level. So there is definite interest in this. And again, what has changed from 2 weeks ago that would warrant us making a big switch? I haven't really heard it yet. I could understand people are more scared maybe as we get closer. There's more speculation. But to me, I think we as a board, we need to, as much as possible, try to make our decisions based on the data and evidence and not on, I guess, peer pressure, fear, an uneasy feeling. And there's, you know, I have no illusions that it's going to be easy if we end up going with a hybrid opening. It's going to be hard. It's going to be difficult. It's going to stretch everyone in ways they've never been stretched before. But I think it's worth doing because there's a significant portion of our population that wants it. And what I would argue, there's a significant portion of our population that needs it. When we're talking about, like Jim used the phrase, we need to let safety rule the day. This is not an issue between safety and danger, or safety and not safety. There are health risks and there are problems with going 100% virtual. Now they tend to, I think, be centered around our most vulnerable students. 21% of our students are from low-income households. 18% of our students are special ed. These are the students that will be impacted disproportionately negatively with a fully virtual education and no in-person option even. And I believe that that group tends to have less of a voice, less agency in these deliberations. So, I mean, that's what I'm considering. And there is, by in Jim's words, letting safety rule the day, you're choosing that level of, you know, danger for a different set of danger. And so it's not, to me, it's not like a clear cut like this. And it's almost like a choice between the lesser, maybe different evils, right? But we wrestled with all of this 2 weeks ago. The threat of not having enough staff was known 2 weeks ago. A lot of the concerns were known 2 weeks ago, yet we had a plan that was recommended by Jim and the team, advocated for by them, debated by us, and then eventually voted on and approved. And again, 2 weeks later, I haven't heard much significant changes other than possibly second thoughts, buyer's remorse, maybe. I don't know, but that's my concern in my perspective. And also, there wasn't really much talk about data around health indicators or COVID-19 indicators as being a factor in this decision-making process. Because if we looked at that, the actual indicators nationwide, I agree, there sounds like there's lots of problems in different parts of the country. But looking at our local area, not just Montgomery County, but even more localized to our district that we serve, the data on the coronavirus indicators is actually been pretty good, and they've been holding steady. So if the data actually says it's safe to at least attempt some in person with mask and social distancing and all that, if that had changed, then to me that's data and evidence that would, I think, maybe make me feel a little bit differently. But since that's been holding steady and there haven't been significant changes, that makes me less likely to want to change course at this point. And there's a lot of emphasis on like teachers and their concerns, but it's like exchanging that, but then putting the burden and the challenge on parents with school age kids too. So it's not, again, it's not like a choice of like safety versus not safety, inconvenience versus no inconvenience, or challenge and difficulty versus no challenge or difficulty. You're just sort of shifting it around. And again, I feel like we debated and discussed this 2 weeks ago, and that hasn't what we've heard hasn't represented a material change from what was known 2 weeks ago. So I've talked too much. I'll let other board members speak. Ronnie.
Okay. I'd like to say a few things since I've spent most of my adult life in Wissahickon classrooms. The thing that keeps going through my mind is a typical day. I'm in my classroom. At home, I put 6 feet distance between chairs and realized how absurd that is. But then I picture myself in the classroom and it's 9:45 and little Tommy comes up to me looking at me over his mask and says, I don't feel good. I already know he has a fever. I'm a teacher, I'm a mom. He has a fever. What do? I can't send him to the nurse with another student like it usually would be. And then I think, he's with me in this class with 20 some kids. I had a meeting with other teachers today. He rode the bus. This is one student and it's swirling out of control with one student. I feel like if we start opening and this starts to happen, which it most likely will, why do that? We should start virtual. The virtual program is much different than it was in March when it was dumped in the teachers' laps. Everybody has been working. Gary has told us how it's going to be a lot different. I don't feel safe saying in August that we're not going to look at this again till January and then we'll see. No, my recommendation would be if we're going to start virtual after first marking period, now let's look. Why would we wait till January? We don't know what's going to change, but we're not even going to look. We're going to have school virtual till January. Doesn't make sense to me. Things might change.
The scenario Ronnie described is a scenario that was an obvious scenario 2 weeks ago and should have been taken into consideration in the original recommendation of the plan that Jim and the team brought forward. That's not a new realization that that scenario could have happened once we open school in person. So I think it's a valid concern, but again, that should have been factored in, and I believe was factored in or assumed was factored in our first set of deliberations 2 weeks ago.
So can I ask a question on that?
Yeah.
So like Ronnie was saying that she would have 20 kids in her classroom, but there wouldn't be 20 kids in the classroom for the most part, correct? If in the elementary school, 40% of the kids aren't going, and we normally have, say a 5th grade class might have 25 kids, and you have 40% of the kids that elected to go virtual, then, you're down to
Yeah,
whatever,
Tracy,
a little bit more than half of that.
it won't work that way. The class size guidelines are going to still be the same class size guidelines. So, in general, it's possible that we may have a student or less in a classroom, but generally, if you have 75 kids, 25 is your max and 25 are virtual, you're still going to have 25 and 25. So
does that mean we're going to have less teachers in the school?
yeah,
Is that what you're saying?
at elementary, under the current, if you're saying under the current plan,
Right.
Yeah.
Okay.
So I have a couple of questions also. I guess this is for Jim, Wade, or Gary. So if school were to start tomorrow, based on what we know from the survey results, the most recent survey results, would we be able to adequately staff the schools based on the percentage of students that we expect and the percentage of teachers that we would expect? Can we do it now?
Yes.
Okay. And is it close? Are we just meeting the threshold of the minimum number of teachers needed? How close of a call is that in your opinion?
Well, we have as many teachers as we need. I mean, that's what we have budgeted all these teachers, and we hired a bunch in the summer to replace teachers who we just like we normally do. So we have the amount that we need now. All the 35 people who've contacted Kathy and shared specific concerns that may or may not qualify them for being out. We could probably accommodate, if they're interested in or if they can do virtual, probably accommodate some of them for the virtual teachers. But we're going to have to do some hiring. But I mean, we can.
Okay. And the teachers union representatives, I know they were a part of your task force. Where do they stand on the issue? What's their position? What do we know how they would be advising teachers? Do we have a good indication of that sort of thing?
Well, the difficult place they're in is for them to come out and recommend 100% virtual means they have to recommend that some of their union mates would be furloughed. So they can't do that. We know that across the state, well, I'm not going to use Philadelphia because that's a different teachers union, but other areas are getting inquiries about the vagaries of the law, the various leave provisions. I don't understand them. Thankfully, Kathy does, so she can answer their questions. But while they can't take official position because they're going to, it's just not, they can't do that. They're all one union now. There's lots and lots of inquiries.
There's some,
Okay.
some are, I'm sorry, Paul, to interrupt you. There are some teachers and support staff members who are still waiting. Colonial School District, for instance, is also meeting this evening, and we have several parents, several teachers who are parents in that district and support staff members. They're waiting to see what Colonial will do. That will affect us too. And anytime anybody goes virtual in the middle of this process, it's going to affect us.
Okay, helpful. Can you just take us through a scenario as to what would happen in the event that we open schools and we don't have enough teachers on any given day? What happens at that point? Are we dismissing schools? Are we overfilling one classroom with the next? I just want to kind of understand the magnitude of, if we're into this, how fast we can react, what the protocols would be, what would take place.
So on one singleton day, like we do now, it will be a mad scramble at the morning. We would not put, now that's a good point. We have options at our disposal now to help when we're short on teachers. Many of those options will be taken away. So for example, we can't combine classes. We wouldn't necessarily be able to pull in related arts or encore teachers to cover, maybe a little bit, but the daily, shall we say, fun time in the morning is one thing. But if it looks like it's going to extend to 2-3 days, then we're going to have to shut down. We just don't have a choice. If two people, if the tests come back as positive, and so then we have to, and then so those two people are out obviously. But then if, say, some people have to quarantine, we'll know that, so we'll know in advance, and then we can say, okay, well, the school is shutting down and going virtual. That's not going to help with planning for daycare. It's kind of like a snow day, I guess. in the sense that it's very difficult to plan for on the home front. I get it, but we could close on a dime if we had to. We're much less flexible, extremely less flexible on a given day, taking care of the getting the school day started just because of all the vagaries of this thing.
And that would be on an individual school basis. So if that happened at Shady, for instance, are we just closing Shady, or will we be closing the district? How does transportation work?
We'd probably lean a lot on Montgomery County Department of Health for that kind of thing. They may or may not recommend shutting down a school. They may tell us to shut down or not. If it's a little wider outbreak, they might close it themselves. But it could be done by school. I mean, we always try to avoid that. Like if there's a power outage, we do it. But then all sorts of other complications enter into the fray. But it can be, to answer your question, it can be done by school if we needed to.
One of the concerns that after speaking with staff is there's quick shutdown. If they know we're virtual for some period of time, there is the ability for staff to try to cover their children and their needs for their children. And if we shut down on a dime, it's more difficult for our staff, and this is their words, to find daycare, to find childcare, those types of things. At least now, if they're planning in advance, they're able to, at least plan and have some and know what's going on. If we shut down quickly, it's going to be much harder for the staff.
But Kathy, this is a scenario that was before us 2 weeks ago. This is not a new scenario that
I understand.
that people would have had an aha moment and figured out that, oh, this is a possible challenge.
Well, actually, I would say that I did have an aha moment. So,
Jim, I have some questions. I listened to Tracy, and I think she made a good point that as a layperson, it's oftentimes smart and appropriate to rely on the professionals in the field. And Joe rightly stated that when we voted the first time around, it was based on the recommendations that you and the other professional staff provided. So I'd like to ask some questions of you. I presume you didn't make this decision alone. Am I correct, Jim?
that's correct.
I assume you made this decision along with other professional staff within the district that we rely on. Is that correct?
Yes.
You're also a teacher by trade. And I presume then that if we could get in to class and teach our kids full time or within the class as best we could, you would prefer that, wouldn't you?
As opposed, it feels a little bit like I'm on witness stand here, but it's okay.
Well, unfortunately, that's the way we're doing this. So,
okay.
Counselor, I'll allow it.
I'll get my counsel over here and let me see if I can answer that.
as a teacher, I presume you'd rather be in the class than in any other scenario, correct?
I always loved my time with my kids. So I guess the answer to that is yes.
And based on what you said earlier, you said this is safety driven to a certain extent. So I presume you took safety into account when you made this recommendation. Is that true?
Yes.
You also, I presume, took into account the guidelines that we have gone over to try and get the kids safely into schools along with the staff. Am I correct?
Yes.
And with that, I also presume that you reviewed and analyzed and took the risks into account. Is that correct?
Yes.
As well as the well-being and thoughts and wishes of the teachers based on the surveys we have. Is that correct?
Yes.
You also cited the other school districts around the country that have opened and immediately closed because of cases of COVID within the schools, correct?
Yes.
And you also put up charts and graphs showing that there are other districts in our area, numerous districts in our area, that have decided to go virtual for at least a certain period of time, correct?
Yes.
So based on what I have heard, it appears to me that you convened this meeting to make a recommendation to go virtual, not simply on a whim or because the wind blew a different way, but you took into account multiple different factors. And so my question is a simple one. Based on all of the information, including the quote unquote data points that Joe raised, is it your opinion as the superintendent upon which we rely and which we relied on 2 weeks ago when we took our vote, is it your opinion that we should not be returning to in-class, in-person learning on August 31st?
Yes.
Okay. Now, I understand that based upon your experience, education, and training. We as lay people take that into account, and we are placed into an impossible task, as Tracy stated. We are officials. We are responsible to everybody who goes to the school district and everybody who is
Marshall, your sound was, something was happening with your sound.
Okay, so better now?
Yeah, it's better now.
So based on what I'm hearing, there is a risk involved into going back into school. And although Joe said it's not a safety versus a non-safety issue, that appears to be, at least in part, what we are making and basing our decisions upon. Schools are opening and schools are having an adverse effect with the virus. We have a duty to decide what works best for our school district. And it is not an easy decision. And I'm getting asked a lot of times over the last couple of weeks, how happy are you that you're a school board member? And it is not an easy question to answer. But I can tell you that, do I regret being on the school board? The answer is no. Because if somebody was going to make a decision for me, I would want them to take into account all of the options and all of the scenarios. I voted 2 weeks ago not to return hybrid, not because I thought that kids shouldn't return to school. I wish they could return to school 100% of the time. I have skin in the game. I have a rising senior in this school district. And if you don't think I don't want him in class, or I don't want him in his extracurricular activities, or I don't want him putting himself into a position to get into the best college possible, then you don't know me at all. But I will tell you this. I would only want to send my child into a school if it was safe enough to do so. And in doing so, I would not want to send any of your children in if it wasn't safe enough to do so. And there is a risk. And although we point out that the risk may be 2.5% in the district or in the county or whatever it may be, that's without anybody having stepped back into a school district in our area. That will change. That percentage will increase because we are seeing it across the country. So the question becomes, are we willing to accept the risk? And many people are. We've gotten numerous emails, all of us, hundreds of them on both sides of the equation, asking us to consider this and take it seriously. And I can tell you, based on everything you've heard and everything I've dealt with, we've taken this incredibly seriously. And I don't think there's any one of us who wants to do something that isn't right and isn't appropriate. But I will ask this, even if it is only a 2.5% infection rate, which of those will we choose? Whose child do we want to pull out and say, you're the one? Which teacher? That you not only infect and go home, but all of those around you. Joe, you're exactly right. We have to take into consideration every portion of our population, including the ones most at risk. But aren't we putting those most at risk at even greater risk by putting them into classrooms? Aren't we putting them at a larger risk if you send them into class and they go home and don't have the infrastructure to care for them? I would think that you do. You can disagree with that.
I do.
I'm okay with it. That's fine, Zeffie. That's why we have different opinions. But at the end of the day, as public officials, we simply have a decision to make. And our decision is, if we let them go back in against the recommendation of the professionals who we rely on, and somebody gets sick to whatever extent, what is your answer to why you allowed that to happen when the recommendation was not to let it happen? What possible reason could you have that would be more important than the safety and well-being of the children and staff in our school districts? For that alone, as you stated, we are looking at the best of bad options. Nobody is stating that we have an optimal option here. But of all of those options, what is the safest? And that should be the overriding concern, because this will pass at some point. And I think we would be much better served by saying, let's let the kids get to the point where we can all get back in at some point, then God forbid they're unable to. So my perspective,
I'd like to go next.
answer my questions, Jim. Thank you.
Okay, I've been trying to get in
Okay, Ron.
times before. As it turns out, Marshall has, as usual, stolen a lot of my fire. I agree a great deal with what he said. I voted for the hybrid system, thinking that we might try it, though I, in my heart of hearts, or let's say in where the demon dwells, I expected us to have to very quickly go to virtual because of this is even before other school districts tried it. You see the disaster that happened in Israel and a few other countries. And I think there is, as far as the students coming in, the parents taking their temperature and so on, Ronnie and I have been in classrooms for many years. And we know that the way kids come in are not necessarily in sterling health. Either they've hidden it from the parents or the parents are trying to hide it from us. This is all grades. The kids come in and they want to save their 10 sick days so they can take a mental health day sometime during the year, and they bring whatever they have into the school, and the likelihood that they're bringing what we're afraid of here is COVID-19, and then the reality of expecting our students to be sterling and pure all the time of day, I think is impossible. Again, Ronnie and I, Ronnie in the 4th grade, I in the high school grades, know that what students do when you're not watching them is not exactly the things that would make Dr. Fauci dance in the streets. And or some kid goes on a vacation with his parents to another city or state, happens to be in a hotspot, and brings it back and doesn't show symptoms, and it spreads. And then you have a classroom quarantined, and then you have a school quarantined in a high school because the kid will have been in 5, 6, 8 different classes during the day. And then you end up having to close down the entire place. I think in the long run, what Jim suggests is the way we might have to go in. Though I think it might help if Jim, you could point a little more specifically to what took you to the point where you abandoned the hybrid and decided to go full virtual. That might help focus our attention on this, if you could do that.
I could do that, but I know there are people who want to speak, so.
Okay.
Yeah, Ron, I know Zeppy's been wanting to speak, but again, Ron, what you're describing is information that was all known 2 weeks ago.
Exactly.
Yet, in spite of that, taking that into consideration, Jim recommended to the board a hybrid opening. But Zephy, you've been wanting to respond as well.
Yeah, and thanks. And, you know, I respect everyone's opinion, of course. And safety is the primary element, but safety is a broad topic for me, because for me, it's the kids that have the IEPs. How will virtual fully support them? It's the kids with food insecurities. I know we ran a food program, but it was open. We don't even know how many of those families who had the food insecurities actually got supported by that program. They were also in locations that couldn't support our full geography of where we are. How are we going to handle mental health needs and concerns in a virtual environment? It's going to be harder and harder to touch these students who need that interaction with their students and the staff that they have interactions with in their school setting. School is not just a place for these kids to get education. Yes, it is, but it feeds them, it gives them hope, it gives them security, it gives them an opportunity to feel safe. Once we take that away and make it 100% virtual, how will we be able to support these children? How are we going to be able to support these students? I know that several districts in our area have made a decision to go virtual. Again, I don't see the data as to how they made that decision. I'm from New York, so I do look at the New York stats very, very closely. And New York City has 1.1 million students, 1,606 buildings and schools, and they're doing a virtual, a hybrid program for their students. I would say we need to give this a try for the students who we are there to support. And I know that childcare is an issue, but childcare is an issue no matter what. And the flip side of that is there's a childcare issue for dual income parents. What are we going to do for those who need to both work and don't have the means or the resources to pay for support, babysitters, or other things to help with their childcare issues? So I do think that we are perhaps missing a non-vocal part of our community that I really want to understand. How are we truly going to support the kids that we really need to hold up the most? Additionally, the achievement gap is only going to get wider when we are allowing this to happen. So I do not feel that we're doing the right thing for our students and our community by going this route. And I don't see how we're going to support all these students in a virtual world.
Can I ask a question? I know we were talking about, if we start at virtual, then reevaluating at some point, whether it's after the first marking period or December or January. But what would the criteria be then at that point to figure out if we were going to switch it over to hybrid? How would the situation in January, say, be better than the situation that's right now, where the rates are so low right now and we're not in our regular flu season? How is that going to be? How do we even think we have a chance of having that as being a better spot to go hybrid than right now going hybrid? Like that's what I don't understand. If these schools are talking about, well, we're going to reevaluate in January, you're reevaluating in the middle of the actual regular flu season. So now if you want to go hybrid, somebody's going to come in with a fever and everybody's going to think it's COVID, but now that's just the regular flu. But how do we figure that out? I mean, really, are they saying by what they're doing and going virtual right now, is that saying we're going to be virtual all year? Because how in January are we going to make a better criteria than what we have right now?
I think we may know more about the virus in 3 months. Think of 3 months ago. Think what we know is different. And I think 3 months from now, it's going to be worse because cases are going up. So we will have more information and more data.
But,
Right, if it's worse, then we're definitely not going to be able to
We're
open
never
in
gonna open.
January.
but
Because
but-
there's a pandemic. That's why.
But again, I think, look, we've been bringing up examples like Israel or schools in other states and all that. Those aren't necessarily apples to apples comparisons. Like in Israel, that's the one I'm most familiar with. I mean, they opened up with some restrictions in place. Then after 2 weeks, they let it all go out the window. That's what really led to the big outbreak there. And then some other states that have some outbreaks, they were in very different, they had different positive test rates and cases than we did. We are in, again, if you look at the data specific to us, sure, there's examples all over the world that are worse and bad, but we need to look at what's happening here locally and the data and evidence we have here locally and use that as a basis for informing our decision. And based on that, the numbers are steady and low. And there's been no big spike in terms of percent positive, maybe number of cases because there's fluctuations in the number of tests you're doing and all that. So the better indicator to look at is the 14-day percent positive rate. And that's been steady for the past 6+ weeks at about 3%, below the 5% sort of threshold where the CDC says you should consider reopening schools with social distancing, masks, and all that sort of stuff. So we're in a good spot now. And if we say that we're going to go 100% virtual where we are now, primarily driven because we're afraid of bad things that might happen. We're afraid that teachers won't show up. We're afraid of what could happen. Then I don't see the criteria, whatever criteria we could put in place to ever consider bringing people back in person other than that people are no longer afraid. That's gonna, unfortunately, that won't we won't get there for a long time. Probably not until we have a vaccine, and probably after we have a vaccine when significant percentage of the population has been vaccinated as well. That to me is not a good basis for making this decision. We should be basing it on some objective criteria and data and evidence. And so relying on the professional judgment of Jim is, I think, valid. Absolutely. We hired Jim to lead and run the district. He has experience as a career educator and been doing this for many years. So yes, we should respect his opinion and professional judgment. But we are allowed to ask, what's the basis of that recommendation? What's the basis of that judgment? And that's what I've been asking. And what I've been getting is, seems more like, again, I am afraid. I have a bad feeling. I think something bad might happen. The data doesn't necessarily support it, but that's what I feel. And again, that's, for me, personally, that's not enough. Not enough to shift my own thinking based on all the discussions and gyrations we went through 2 weeks ago. And again, I think that's the thing to focus on. What is different now than where we were 2 weeks ago? Other than that, we're just trying to take another bite at the apple to re-vote on something we already decided on, or we have like second thoughts about what we ended up doing. So yeah, that's Paige, you had your hands up, please.
Yeah, I would like to add something. For everybody watching, my name is Paige. Just for some context, I'm going to be a rising senior. And I think like the majority of the students at Wissahickon High School and the majority of the seniors, we want a sense of normalcy in our school year. And we want a full school year, but obviously that's not going to happen. I personally, also for context, I did choose the hybrid model because I wanted, if we were shut down, synchronous classes. And I think with the Wissahickon Virtual Academy, asynchronous and not being directly able to talk to a teacher would not work for me. However, I know you said, let's not look at other states, but for me, I look at them as a model. And I see that Georgia and Arizona, they're opening. And regardless of their case numbers before, they're spiking again. And I believe it was 200 teachers in Georgia already had to quarantine within, I believe it was their first week of school. So obviously, I think it's our civic duty. And our civic responsibility to try and lower the case numbers. And yes, our case numbers are low now, but we haven't fully reopened yet. And like Mr. Bleefeld said, none of us have entered a school yet. So would I still love to go in hybrid? Yes, but I think that if we look at the models and when we're not even fully open yet, I don't believe it's safe enough. Regardless, I still am not necessarily a big fan of jumping to virtual for the entire semester. But you bring it up again in November, what are we going to have to base it off of? I think that going virtual until November instead of January would be better, but that's just the opinion of a senior.
I would
Can I
agree
ask a couple
with Paige
questions?
right there about instead of waiting to January to looking at November, because if there is the spike or there's not, or the numbers continue to drop, it would be a good idea for us to then look to going back to the hybrid models that we had voted for previously.
I think David wanted to talk.
Thanks. I just had a couple of questions. One, I think this is probably for Kathy, but it seems to me that, and I'm not no expert in this area, but if many districts around us are going to virtual, would that not tend to free up a lot of the subs from those schools would otherwise have demand for?
Quite possibly, yes, but I just don't know. I don't know the answer to that question. I actually have reached out to all the subs who we've used over the course of this past school year. And several of them are choosing not to sub this year because subs have to, we can't just say, oh, you know, this sub goes to one building every day, because that won't work. We are hiring some building subs who will go to one building every day and work in one building. But in general, subs travel building to building to building. And there's many subs who have decided that they are not ready for that yet. So it's hard for me, actually, David, to know exactly the answer to your question, but I do know there is some concern amongst the subs that I've spoken to.
Okay, thanks. I would say that I share Zeffie's concerns about our most vulnerable students that would not thrive in a virtual setting. That's where my primary concern is. You know, we've been working for a few years now on attacking the achievement gap, and I think this will be a pretty big setback if we don't have the option for those students at a minimum to come in person. Again, I'm not an educator or an expert, so I would defer to your expertise on that decision. But then there's also food insecurities and other students that are just otherwise struggling and wouldn't have the support at home to succeed in a virtual setting. And that concerns me a great deal. We do know that there are countries that have failed, but there are other countries that have succeeded. And I think the common theme has been mentioned by others where they did succeed. They kept numbers in their groups or in their pods low, and they stayed there and gradually moved away from that. Where they failed, they moved away too quickly. But if we have fewer students in the school buildings, if we have 40% of elementary students that are electing to go virtual, that would give us a lot more room in each of the buildings. And if we maximize the use of the building and we're able to get the staffing to have more classes that are smaller, wouldn't that give us a better chance of succeeding? Jim, I guess.
So yes, we'll have fewer students in the building. That will really impact the common areas more, and just the general arrival, dismissal, lunch. Classrooms will still have a number of students, and they're not going to be, pointed out, still have the class sizes. There will be fewer students in the building. a lot of the students will be not in the building and teachers will be teaching virtually.
I see. So we wouldn't try to get more teachers in the building to minimize the numbers of kids in one classroom?
We hadn't planned on doing that. No, we were thankful that there was going to be students for things like lunch and, like I say, arrival, dismissal. Example of arrival thing is we usually stage the kids either on arrival or dismissal in common areas, which we can't do now. So we're going to have to figure that part out, which we can do, but on those crazy days when there's not enough adults, that's going to really test the principal's creativity, let's just say.
I would like to just mention the buses. How will we transport children safely at a distance in the buses? I've ridden on the school buses, and when you're sitting next to your seat partner, you're very close. Well, how will we can't send kids that we're going to have like 10 bus routes every morning? How are we going to do that?
I know that a lot of the parents have already been talking about how they're going to handle it in their neighborhoods so that their kids don't have to go on the buses. So I know I've been in the bus line. I know that there's a lot of parents that already drive their kids to school. And there's already a lot of parents talking about driving their kids, more parents driving their kids to school. So I don't know that we'll have the huge numbers on the buses. I mean, we will have to bus transport some kids, absolutely, because they don't have the option of parents driving them, or the parents, just can't, they're at work or whatever. But I know that there's parents already talking about how they're going to handle driving their kids to school. I don't know what the numbers are.
So figuring out busing and transportation, that's obviously a challenge. Not a new one, not one we figured out 2 weeks ago. Yes, we'll have to think differently. Yes, we'll have to adjust and adapt. There's no question. And it's going to be hard. Maybe we don't have it all figured out yet, but that doesn't mean that we shouldn't try, or that doesn't mean that there's no solution. So again, I keep going back to all this stuff was known 2 weeks ago, and taking all that in consideration, Jim's recommendation was the hybrid model. So I'm again focusing because I want us to really there's a lot of issues and a lot of concerns and a lot of stuff swirling around this, but to try to simplify it, I'm trying to hone in on the key changes that would make Jim switch from his original recommendation. Some of these things you bring up, these challenges, they are definitely challenges and they're problems for sure. But that's not new information is my concern and my problem with kind of a line of reasoning here. Yeah, Alex.
Hi, I just wanted to chime in real quick about this decision. And I feel that since the beginning of the debate about going with the virtual and the hybrid plan, it's always been something that I didn't know what would be best. And now that I'm approaching the school year, as much as I would love to go to school on the first day and see all my friends and actually get to learn and get out of the house, I feel that there's many concerns that come with this and many safety risks we put ourselves at and our families. And that I feel that with this new plan by Dr. Crisfield of having a period where we can go virtual and reevaluate ourselves during the school year, I feel that this is an opportunity to see how other schools operate with COVID and just evaluate our WSD plan based on how the world is and how other school districts operate. The only one thing I would like to ask, and I know Paige has mentioned this, is there a way we can consider reevaluating the plan about going to hybrid sooner, maybe at the end of the marking period in November?
Can I jump in here? First of all, let me just emphasize this is why I love being in the classroom with kids. Paige and Alex analyze things better than most, and your input's very appreciated. Yes, we can. The January date was the semester turnover, which for high school purposes is a good one because sometimes new electives kick in. It doesn't have to be January. It was just a natural break for secondary classes, but it could be earlier, maybe marking period or something.
Jim, what criteria
thank you.
would you propose to evaluate the readiness to go attempt some form of in-person?
Well, sort of to your point, that hasn't changed. The criteria hasn't changed in the last 2 weeks, so it's the same.
And it is,
Well, we'll need a vast improvement on the test turnaround time. So that
Wait, Jim, I'm going to interrupt you there because I just pulled up, let me find it here. Montgomery County just signed a deal for testing
yes,
with Mako Medical and are expecting test results to be in little over 1 day.
right. So they're going to fly those test results down south to some lab somewhere and fly them back up here. Within 1 day would be an interesting turnaround on that. It will be better. So that's a good thing,
Yes.
actually. That's sort of what Alex's point was, is that we can observe how the better improved test turnaround time does with the decision to, or the need to quarantine. Can we get quarantine people identified and out faster? I mean, I don't even like talking about having to identify quarantine people and getting them out, and then, but see, the thought is that they'll be in the building while they, could possibly be spreading. So the answer would be and I hope that Montgomery County, I applaud them for trying. They so far have had a 7-day turnaround, and that's crazy. We're going to need the contact tracing, which they say they're going to do. They say they've hired 30 or 26 people to do the contact tracing, which is actually awesome. Whether or not that will turn around fast enough, no one knows, because it hasn't had to do it yet. And I would just say that what would change is the ability to envision the start of a school day and be much more comfortable that we could staff it safely and reliably.
So, but like Joe said, what, I didn't really hear criteria of come November or whatever date that we pick. What would have to be the change in the actual criteria? Because you just said basically a feeling. It would have to feel like it's better.
Correct.
But if everybody is afraid, and everybody's been afraid since March, I don't know that there'll be less afraid in November. And if there's not actual criteria, then how do we know? My fear is that if we don't start out hybrid when it's low, that come November or January, it's going to be higher, and we will be out for the whole year without even trying to do a hybrid at all.
See, you have a fear, and you're making some thoughts and having some thoughts and decisions on a fear. It's okay. I don't see why.
Absolutely. I'm just saying, I don't know that that's how do you put criteria into place to change from all virtual to hybrid?
It's a very reasonable question. We superintendents and county health officials have been struggling with that for the last 2 months. There is no answer.
Well,
Jim, you can throw percentages out, and you can throw rates out, and we just don't know.
Jim, I can't help but think the reason that you don't have any data points on this is because it hasn't happened yet. We don't have the data because nobody has returned to school. So if you hope for the best and hope it and open for hybrid, hoping that there are no tests, that's wonderful. But if you open and people get sick, now you start to have data. If you go virtual for, as some people have mentioned, till say November, you now have several months of actual in-class data to know if the numbers changed, and if they did not, or they went down, you could then go to the hybrid model having safely determined that you can do it. Or you could say, you know what, not a good idea to go in school, other schools are doing it. My guess is that's why other school districts have decided to start virtually, is that they don't want to hedge their bets, and they know that there isn't the data yet to know what will happen, other than other schools have opened across the country and they've had issues.
Yeah, and you know, we were given some criteria by governing bodies that are above us, and they gave us a threshold of 5%. We're at 3.2%. That is, to me, within the criteria. So I do feel like we've fulfilled that criteria.
Why is that okay? I don't understand why.
We're not going to be at zero, Marshall.
No, nobody's saying zero.
Marshall,
but
we're not
Zeffie,
going to be at zero anytime in 2021. So I think
I don't know what the percentages are going to be, but it seems like you're accepting a certain level of that risk at 3%. At 3% of our student body, we have 4,000 students, right? So that's 120 students. Who are you picking out of the line to say it's okay? Who are you going to look at and say that's okay?
And then there's 20% of our population who have IEPs. How are we going to take care of them? There's 20% of our population who are food insecurity. How are we picking them out? I mean, come on, Marshall, we can do this all night long. I think the criteria, we've met the criteria. Wow. We had this vote 2 weeks ago. Jim gave us this recommendation 2 weeks ago. He has no new data to support a change in direction. The CDC, the American Pediatric Association, the New England Journal of Medicine, Dr. Fauci himself have all said we need to encourage and help open up schools with safety precautions. We are doing that.
Well, yes.
That was what was the recommendation.
Yes, you're absolutely right.
Vote, because this is getting really.
You're absolutely right. And you're absolutely right to point out the CDC guidelines, because the CDC guidelines say that you're in a moderate risk if you have small.
And it's the parents' choice, Marshall. Marshall, we are giving the choice to the parents. The parents can choose to send their kids to school or go virtual.
Well, Zeffie, that's not exactly.
And we're taking that choice away from the parents. Zeffie, and from our community.
We use that as a data
I do not want to have any more of this discussion. Can we move on to a vote, please? I move for a vote. Who seconds?
We have Gary has a presentation on what the virtual program would look like. And we can do that or not. I don't know if that would help people feel more comfortable with what they're voting on.
Yeah, we can't vote anyway because we haven't had public comment.
Yeah. I would like to see the presentation of what virtual would look like. And I also have one other question. If we were to start non-virtual, so if we were to start in person, at what point and what would the criteria be at that point to switch to a virtual? So what triggering factor would we need? Is it a certain number of incidences of positive cases? Is it a certain level of absentee teachers? When would we make that reevaluation, and what would we use as criteria?
I can't speak to the number of cases or quarantine. That would be more at the Montgomery County Department of Health level. So they might shut us down for that. We would choose to close down if we can't reliably and safely staff the buildings. I don't have the data. I understand it's very frustrating that their data points aren't here. This isn't in a data world. We live in we're trying to stuff data into a place where data doesn't necessarily always work. And so we try to find it, and the Montgomery County Department of Health is actually very good with getting it and gathering it. So I don't know if they have thresholds or they would just sort of wait and see. I can't speak for them.
Okay, Gary?
Yep. Okay, so the plan that I'm going to share tonight is a plan that has been worked on by the principals, district leaders in putting this together. I want to begin by saying it is quite a different approach to virtual learning than was experienced last spring. I know in conversation and emails with our families, There's a lot of going back to the spring and the fear that this will look very similar to that. So I'm just want to share at the outset that this is very much designed to be responsive to the community concerns we heard last spring, the responses to the surveys that were done in June. And I'll share with you what this would look like. This is the plan that would go into effect if the government had shut us down like they did last March. It would be ready to go. In this particular case, if it was a decision of the board to move in this direction, this is what the plan would look like. So this is 100% virtual instruction for all students K through 12. So guiding our approach to remote teaching and learning, these are the things that we wanted to make sure that we attended to. And I think each of them is important to say, to maintain our curricular program and pacing, because learning must advance. We must cover the curriculum and meet the standards of the state without scaling back. The idea is to keep our program intact. We would be providing daily synchronous instruction for all. And that means that the classroom teacher would open the class every day, would close the class every day, and would do all the typical things that happen in the classroom in a virtual way. So whether that's whole group instruction, working with small groups, having students work in small groups virtually, doing independent work, all of those things would happen as part of a synchronous experience. This would not be worksheets put on a website for kids to do, but it would actually be teacher interacting with students, classmates interacting with teacher, and with fellow classmates. We would continue to provide instructional interventions and supports as per IEPs, GIEPs, English learners, and reading. We would assess, evaluate, grade student work, and provide student feedback, hold students accountable for attendance and work completion, and under the circumstances, continue to remain flexible with students and families as circumstances require in accessing lessons and completing assignments. Attend to students' instructional, physical, and social emotional needs, provide seamless transitions between the virtual classroom and the brick and mortar environments in the event that there was a shift from one to the other along the way. And of course, maintain Pennsylvania's requirements for instructional days and for instructional hours. The technology tools that will be used are just like they were last spring, in the sense that we would be well, I guess we've improved in this way. We are going to provide a computer device for every student. If we go into this direction, one will be provided to every child K through 12. The 6 to 12 already has that in a one-to-one relationship. We would have laptops and Chromebooks available at the elementary schools, and should we go home, they would be given to the family to be used for the time they're home. And if back in school, they would be brought back for the purposes of use in school. We would continue with the same familiar tech tools that we used last spring, Seesaw K3, Microsoft Teams, and Schoology. And this would enable students to engage in all the different kinds of interactions that would be needed within the classroom environment. The student day would start at its typical 8:30 or 8:35 time, 3:15 or 3:20, that should be 8:30 or 8:35. The two of our schools operate on a slightly different schedule, 5 minutes staggered. Middle school would begin at 9 in the morning and conclude at 3:30. And the high school student day would begin at 8:45 and conclude at 3:15, all about 6.5 hours of a student day, which is consistent with what it is currently. This is a sample of an elementary school schedule for the child. What I tried to do here was just show you how the different components would be. We'd have a homeroom and morning meeting, English language arts, the encore, the art, music, PE, physical, health and PE, guidance and library would be during the encore time on a rotating basis. Science and social studies, there would be a lunch break, there'd be math, there'd be afternoon check-ins, and there's a period of the day we call PI, which is practice, intervention, and enrichment, which is individual and small group interactions with the teacher to support students, both in terms of need of challenge and those needing practice and intervention for struggles they're having. The times that are listed on the right give a block of time, and there's actually, it doesn't show any breaks in between, but they have been substantially upped so that English language arts is more than the required instructional minutes, to allow the teacher to have periodic breaks in that time, to possibly take students outside for a walk or a light recess period with a small group of students only. So the day is structured from beginning to end, and the teacher is very much in control of giving the student the breaks as they developmentally need throughout the day. I acknowledge right off the bat, early childhood, this is a challenge for us. And with the young ones, trying to make sure that we have a balance of academics that we typically cover and still giving them the kind of breaks they need during the day, especially as we start the year with students who are not acquiring a full, have not experienced a full day. The middle school schedule follows exactly, I'm sorry. The middle school schedule follows its typical 8-period day cycle with 40-minute periods. They have their all their content core academics. They have their advisory period. They have a lunch period. They have an academic period. And that enables all the different interventions to be provided for them along the way, including special education services, gifted services, reading support, EL services for English learners as well. And for the high school students, we would be running an alternating day 5 and a day 6 block schedule. So there are basically 4 core academic courses being offered on one day with 86-minute classes, which is their fuller block, giving the teacher more latitude and opportunity to work with students and do the kinds of things that need to happen, whole group, small group, labs, things of that sort. There's a lunch block built in. There's a mid-morning break and a mid-afternoon break between those courses. And there would be opportunities within the courses themselves for some kind of periodic brain breaks as well. Day 6 is simply the rest of the course line that the student has elected. There are 4 courses there as well. And basically that's the full schedule for the high school. We like this particular schedule, and parents and students both seem to appreciate this over the course of last year when we did it in the spring, feeling that it was a nice focus on 4 classes with 4 assignments afterwards in the evening, not all the courses in one particular day. The program includes virtual special education program and supports for IEP, GIP, and students with 504 plans. So all of that would continue in the virtual way. We would continue to offer the reading intervention support for students in K-8 who need the services there. Our English learners intervention support would continue for K-12. And we did design an option here for those students who have more complex learning needs. Some of our more clearly programs where students need much more teacher intervention in a very small group to offer some opportunities for in-person delivery of those services at one of our school settings where we would have students come in half-day sessions in very small groups to work with some of our special education staff and get the IEP required instruction delivered for them. The professional development for faculty and staff, I don't want to go through all of it, but basically we had started this last spring, but as we approach August, we're looking at using the opening days in August before the students arrive to refresh tools with regard to synchronous instruction, to look at lesson design that we typically offer in the classroom and how do we translate that to an engaging lesson within a virtual setting. There are distinctive differences in the two. We know about the social emotional piece that we've got to build a community of learners. These have to be communities where students come to know each other. They feel the opportunity to interact with one another. And it's not just just feeding 2 students, but they're actually interactive and engaging with each other. Assessing student learning formatively as well as summatively at the end. Questioning and organizing for class group, small group instructions. How do we use the tools to do that? Providing differentiated instruction, deconstructing lessons and rebuilding them for the virtual classroom, and also identifying potential learning gaps from the closure in the spring, and how do we actually fill those and approach those as we return to school in the fall. This plan is pretty rigorous. It's responsive, I think, to what we heard are important components of a virtual program. I do want you to know that our special ed team has been working diligently to look at all the options to meet the needs of all of our special ed needs students. And again, those with more complex needs to even offer direct instruction to them personally in person. We're looking to do that for certain programs. I should mention here also that our high school team is in contact with North Montco Technical Career Center. They're monitoring closely what opportunities exist there for our students. They are leaning toward a mid-August date, I think on 17th of August, to make a decision about how they will offer instruction to their students. But I do want to know our families of students with students at North Monco, we are working closely with them to make sure that whatever they offer, that we can work compatibly with them to make sure our kids are getting those services and also getting the courses they need here in Wissahickon. I know that each of these different programs that we offer and present will result in parent questions following any presentation like this. And I do want parents to know that in the event that this would be supported by the board this evening, that a brochure with considerable amount of information for what parents and guardians need to know about this program would be sent out to families on Monday or Tuesday next week to give the details about what the expectations are, what the schedules look like. And so I would ask you to be patient to receive that, and then questions that may emerge once you have that certainly would follow up with building principals. I know they'd be eager to be part of that. We have been working together with building principals in fashioning this plan and trying to work the details out, which we're still fleshing some of them out as we move forward. And that's the plan.
Gary, it's Zephy. One quick question. If I'm doing my math right, there's about 4 hours, give or take, that the kids are going to be on their computers in lesson in real time. Did I get that right?
It may be even closer to 5 in terms of the amount of time that's possible for the teacher to use. But again, within those blocks of time, there'll be times when students are off screen. They'll be working on independent tasks that the teacher would typically assign in the classroom, that students would go off to work at their desks. But again, the kids wouldn't be leaving the environment of the classroom. They would know that the teacher's still present, and at some point we'll call them back, just like they do in a classroom when they're working independently at their seats. But this plan does require our teachers to be very mindful of the fact that kids are going to need breaks. They're going to need to be able to get up and move. They're going to need to be able to have those downtimes within this, and more so at the younger ages, I think, at the very beginning for sure. I don't profess to say that this is going to be an easy challenge for us. There's no question. No educator would choose to educate early childhood children in a virtual way. We're trying to do our best in the circumstances, and we believe we have a plan that will do what it needs to do as long as we are mindful of what kids need and the breaks they need along the way.
A question on Gary.
Yes, Ron.
What would a kindergarten look like in full virtual?
Well, it's going to look very similar. The day is going to begin with the teacher opening the day, taking attendance. They'll do a morning meeting, which is typically an opportunity for students to share around a circle. They're going to do this in an online way, share information about their day, their week. They have a chance to hear what the day is going to be dealing with, what they're going to offer the kids during the day, what they're going to be reading about, learning about. That usually takes about 20 minutes to half an hour. They will talk about the weather. They'll talk about what day of the year it happens to be. They'll do their counting of days by 10. All the things that they do is a natural part of the opening to the day. When it comes to English language arts, they're going to have a story that will be shared with them by the teacher that'll open the session with probably a 10-minute reading with some discussion. And then students would likely go then and work either on an independent task or work on a group task. Which could be journal writing at this point. That may be in the very beginning for our kindergartners is more about drawing and then sharing their drawings with their classmates. The activities, the experiences will be developmentally appropriate. They'll be delivered in a virtual way. Kids will show their work on a screen. And those are the things that will be happening. Will it look like, yeah.
Gary, how realistic is that model for kindergartners, first graders, second graders, 'graders, 2nd-graders, 3rd-graders, 4th-graders, 5th-graders, 6th-graders, 7th-graders with them? 7th-graders, 8th-graders, 9th-graders, 10th-graders, 11th-graders, 12th-graders, 13th-graders, 14th-graders, 15th-graders, 16th-graders, 17th-graders, 18th-graders, 19th-graders, 20th-graders, 21st-graders, 22nd-graders, 23rd-graders, 24th-graders, 25th-graders, 26th-graders, 27th-graders, 28th-graders, 29th-graders, 30th-graders, 31st-graders, 32nd-graders, 33rd-graders, 34th-graders, 35th-graders, 36th-graders, 37th-graders, 38th-graders, 39th-graders, 40th-graders, 41st-graders, 42
Well, I mean, that is a concern. There's no question about that, Joe. And I know that our YMCA is an example, and some of the other daycare facilities in the area have actually contacted me and talked with me about how they can be supportive of the students that they have who are going to daycare facilities. And many of them are already working on the fact that they're setting up systems so that the students, whatever school district they're in, can bring their computer, log on to that class and be supported by assistants in the room to let them continue with their class. That doesn't answer the question for every child, however. I realize that. And there'll be some circumstances where maybe a child is at home and unable to be logged in and have the support that they need to do that. We will need to be recording these lessons and making them available as needed for those students or parents who need to view them at a later time in the day. That's one accommodation we can make. But I think we will definitely be working with families who have that challenge and trying to meet those needs. But again, that's a very real issue and certainly something we know that we have to be concerned about.
And the population that will be the most challenged with that, again, will tend to be our lower income students. And we are, based on the recommendation, eliminating the option for them to come into to have any in-person education. That's the recommendation, right?
It's the recommendation not to deprive them. It's the recommendation to go virtual, but not to deprive them. And we're doing our best to try to meet that need with providing the computer, providing internet access if we need to do that as well. We did that last spring, and I think we did a fairly good job. And I think many of our families reported that they were able to actually be involved. We did have students who were at most risk this summer attending reading and math tutorial sessions with our teachers and attended in the summer and kept pace. Not everyone, but a large majority of the students who were identified in need. So we did have experience with them, and our reading specialist reported that those who were able to attend and participate did so with good results.
Any other questions for Gary? Okay. Is that it for the fall reopening plan, Jim?
As far as I'm concerned, yes.
Okay. So I guess as an order of business, we spent, almost 2 hours at this point discussing the proposed change to the fall reopening plan. We can talk about the health and safety plan, or would people prefer to close out this piece with public comment and then a vote?
The public comment.
And then vote on this item, and then we can move to athletics? Is that okay?
Sounds good.
So yeah, I think just for continuity and just to kind of close out this topic, we can move to public comment. We got quite a few public comments. I mean, our emails have been flooded with emails from folks expressing their opinion. And I think it was similar to the flood of emails we got 2 weeks ago in terms of volume. I think the tone and the direction they're pointing is like the complete opposite. But again, tons of emails. There's no way we could attempt to read them all, like I unfortunately tried to do at a previous meeting. I'm not going to make that mistake again. What we did do, and is as specified in our agenda, the protocol we had in place for our normal meetings was to have up to 5 comments on an agenda topic. We got, as I said, plenty of emails, dozens and dozens, triple digits of emails. In essence, what we did was took the first 5 that we received, starting from the point when the agenda was made public, and also the nature of Jim's recommendation was made public sometime, I believe, yesterday, mid-afternoon. We also stripped out emails that were primarily just questions and focused on emails that were more of statements to the board, which is what the design of the session was really for. So with that, I'm going to read through 5 comments that were emailed to us at the board meeting email address. The first one is from Andy Russo, and it reads, "This is extremely disconcerting that within a week, there is a switch and planned vote on 100% virtual learning for elementary school students. An 8-year-old child should not be subjected to being online for 7 hours a day. This is not learning. The board should stand by its original plan within school learning for elementary. You just can't change the plan without contingencies or providing tutors, etc. My son does not take to the online learning very well and will be unduly hurt. Please don't change the plan. The next comment is from Stratus Bananas, PhD. In reading the agenda for meeting on August 6th, I'm very distraught that now we are considering 100% virtual as the only option. There is no reason to just have this option. The cases in Montgomery County have not increased dramatically. There was only a slight bump and cases have stabilized. The Association of Pediatrics, Dr. Fauci, and other reputable organizations recommend that kids attend in-person school as much as possible unless you are in a hotspot or the number of cases have significantly increased. Neither is the case for Montgomery County. We are doing a disservice to our kids and parents if there is no option for in-person school. Excuse me. I understand that neighboring school districts have chosen to have an only virtual option, which is their choice and should not influence our choice. If other districts are influencing our choices, then why bother having our own district? If we do 100% virtual now, what do you think will happen in January? Things will not improve in January. It may be even worse during the winter flu season, and the likelihood of having a vaccine is very low. My kids, which are great students, are eager to go back in person because the 100% virtual will crush them, excuse me, their motivation and educational development. They barely dealt with 3 months virtual. How are kids supposed to stay motivated for 4 to 10 months? Please don't be influenced by neighboring district choices and look at hard evidence. There is a reason we are one of the best districts in PA. Let's not destroy the development of kids and reputation. The third one is from David Bozak. So your suggestion is now to go against the American Academy of Pediatrics and myself, a physician, and countless others who can look past the politics and left-wing media creating fear to give our kids no choice to return to school. You're giving into peer pressure of neighboring places who are doing the wrong thing. This shows to me that it's not about what's best for our kids, since I would think the pediatricians would hold the most authority on that matter. Then there are all the secondary ramifications you will be causing, from families in financial trouble when they can't work, to the mental health issues of our own children, and more isolation and not being able to learn as well. And I could go on and on. I'm not very hopeful that the board will make the right call and reject this notion, but feel the need to at least put forward my strong disagreement with not allowing our children to return to school in person. And my wife can just not work, so I have no financial incentive for this opinion. It's based on facts and data. Please reconsider. Comment number 4 is from Melissa Brown. I understand that the change to 100% virtual is inevitable. The plan mentioned that elementary lessons would be synchronous, requiring students to log in and be accountable at certain times during the day. Many parents may be working during this time and relying on their older children to be responsible for younger siblings during the work and school day. Is it possible that lessons are taught synchronously during the day, be recorded so that working parents are able to sit with their children and work them in the evenings? I can't rely on my middle/high school child to be responsible for their own workload and add in the responsibility of tasking the younger sibling to do their work at the same time. Having the ability to log in later would be very helpful in a situation like this. The last comment is from Mike Honer. My wife and I are really struggling with what appears to be a complete reversal by the administration. Throughout 3 extremely long board meetings, we listened to both Superintendent Crisfield and Assistant Superintendent Avamont repeatedly talk about how important attending school physically was, particularly for elementary students K through 5. Now, with less than a month to go, there has been a complete about-face on the recommendation, despite no evidence of a drastic change to our region's virus rates. You also have left parents with 0 time to consider the other options, i.e. private schools and or child supervisory needs. We were beyond excited for our little guy to start kindergarten this year, and unfortunately, those hopes are now dashed. Please consider keeping the previously approved elementary school options open. Up until this point, we had been extremely impressed with the level of talent, thought, and professionalism that has gone on through such a horrible, difficult situation by both the board and administration. Also, I strongly suggest reviewing the attached, your reference as an exhibit that was attached. And that is the 5th public comment read. What I will say is that although the large majority of the comments were against 100% virtual. There were a minority of the responses that were advocating switching to 100% virtual.
Joe, you're going to read the one that was sent in that's related, but what we felt was important enough to be added.
I stuck with the first 5 that were submitted that were not questions in nature and more statements.
Yeah, this one is about the topic, but it wasn't really necessarily reopening. She was sharing a personal situation, what we felt was important.
Right. Okay, so those are the public comments, and I think at this point, Jim, unless there's anything else to say, I think it's time for a vote on the fall reopening. Well, I ask for a motion, I guess, for approval of the revised fall reopening teaching and learning plan dated 8/6/21, which calls for 100% virtual instruction for all students in grades K through 12 for the period 8/31/20 through 1/22/21 per document 6-1. Excuse me. Can I have a motion?
So moved.
Anyone second it?
Second.
Okay, the motion has been approved and seconded. I know that this is a controversial item, obviously, so I'm going to ask for a roll call from Wade, but before that, any final comments before we do the roll call vote?
Yeah, I would like to point out that there is one scenario that hasn't been widely discussed, and that is one that we actually succeed getting back to school, minimizing infections and transmissions, as has been done in lots of other settings. Where I go to work every day, we've had very few infections and no transmissions amongst the employees, as far as I know. I think that if we implement the safety plan as it has been put forth a couple of weeks ago, that proper cleaning, mask wearing, adopting all those practices that we know we need to, and I think the kids will learn it too, that we can succeed.
Ron?
Yeah, I think we owe it to our community to at least give it a chance of having the hybrid plan. And as I've already indicated in my in the demonic part of my heart, I don't think it will work, but I think we should give it a chance, because as Dave just said, it might work. And wouldn't that be terrific if it did? We have the structure so that if we have to rotate out of the hybrid into full virtual, we have the structures already created, and it wouldn't take us too long, I don't think. Easy enough for me to say, but it wouldn't be as terribly hard. We wouldn't have the delay we had in the spring, for instance, to then swing into the virtual if we had to, if it fails. And I think it should be made very clear to the parents, the community, and of course the students and the staff that we are trying to do this, and whether this succeeds will be dependent on their behaviors. And let's see what we could do. I don't like the vote. I don't like either choice, but I think let's try the hybrid system for a while.
Until someone gets sick and dies? Is that how long we should try it?
Well, I certainly don't want to repeat the words of our esteemed president, but there are, when you hear about how some families are coming about ways to get around virtual schools by creating pods, that is a system that is also designed for to spread disease. and there's very little control because you have thousands of pods with people that have little or no training or interest in keeping the system sane. As I said, I don't like anything. If you remember, and I agree in many ways with almost entirely with what Tracy said when we opened this meeting. This is something that is a horrible decision. No matter what way we go, there are students who will suffer.
All right, thanks, Ron.
And I think what we have to do is I'm sorry, I'll be finished one sec. We have to do what is give our students the chance to succeed.
Okay, thanks, Ron. And final comments?
I have one question. I know we've been talking about this and we're coming up on the athletic program next, but the athletics have been practicing for a couple of weeks now. Have we had any positive cases involved with the athletics?
No, we haven't. So we've been doing pre-screenings before every workout. They've all been outdoor activities and non-contact, but we haven't had any positive COVID testing results.
Thank you.
That doesn't help us with the classrooms.
Okay, final comment before we vote. Marshall?
Just quickly, I'm reading, we're on number 1 of the voting. Can you just read back? I want to make sure it's clear as to how we're voting on the question, because I'm reading it online and it looks a little different from what you said.
Okay, this is the copy that I have before me. This is a motion for the approval of the revised fall reopening teaching and learning plan dated August 6th, 2020, which calls for 100% virtual instruction for all students in grades K through 12 for the period August 31, 2020 through January 22, 2021 for document 6-1.
Got it. Thank you.
Does that match what you're reading, Marshall?
Yeah, I just heard it differently from the first time you read it.
Comment?
I would like to know if there's any wiggle room in the idea of waiting till January to consider what's going on. Is there a possibility that we could have the plan for virtual and then look at it after first marking period? I think waiting till January is long.
Yeah, we certainly could. I was sort of responding to Alex's, you chose that for the semester break, but we could do it for maybe most courses and grades after a marking period, or in the elementary case, a trimester. And then maybe if it doesn't break well for high school, you know, that one course or something could be later, but there's nothing magical about January.
Jim, I just wanted to share quickly that one of the bases of that January date was because the students who register with the Virtual Academy, the Wissahickon Virtual Academy, it's a semester-based program. So they would begin August 31st or their starting date, and that would bring them through January. And then the thought was at that midpoint, that would be the point to make the decision whether to proceed for the rest of the year with either that or bring students back. So it was a semester break based on the courses associated with the academy.
Thank you.
That decision point can be made on with both decisions sooner. So if, for instance, if we go back in person, could we also reevaluate in November, hypothetically, just as we could with the virtual?
Sure.
Okay.
Would that require an amendment to the motion?
No, we will. If we have to close down, we'll close down. We don't need to vote. I mean, we could hold a board meeting at that time, but we don't need to I mean, closing down would be a result of not being able to staff the buildings.
Anyone else with a final comment before we vote? Okay, I'll add the last comment before we take the vote. Is one for me, the biggest thing I struggle with and why I am going to vote no against the recommendation is that I do not believe it's right to remove options for parents and families. Every individual family, student has the right to decide for them what they feel most comfortable with and what's safest, whether that's hybrid, in person, or totally virtual. That's everyone's right. Just like Paige and Alex, that's absolutely their right to feel the way they feel and choose what they want and think is best for them. But I am less, I guess, in line with removing the option from parents and students who have a different opinion and a different tolerance level. So that's number one. Number two is that if we decide to, as a board, majority vote to go to virtual now, my concern is that we're doing this without any sort of clear criteria or standard for why we're doing this, other than, again, perception and some degree of like fear or assessment of probability, right? But not really based on data evidence or a clear standard. And so I don't see a clear path for how we would establish clear criteria or a standard to then down the line be willing and able to go to in person. So those are the two primary reasons for me why I'm going to be voting no on the recommended motion. And with that, Wade, can you conduct a roll call vote, please?
Mr. Badger,
No.
Mr. Bleefeld,
Yes.
Mr. Frank,
No.
Mrs. Heyman,
Yes.
Mrs. Nikes,
No.
Mr. Stoloff,
No.
Mrs. Walsh,
No.
Mr. Antonio.
No.
The motion fails 6-2.
Okay, thank you. So with that, Jim, we're going to switch now to the athletic health and safety plan.
Okay, happy to introduce Jim Cairns, who already weighed in once with some athletics-based information, and he's going to share with us what phase 2 might look like. Jim?
Hi, everybody. One, thank you for allowing me to present. I'm going to share my screen and talk over it a little bit. I have 3 or 4 quick slides that we can go through and hopefully answer any questions that you may have. All right, so once again, thanks to Jim, Lynn, and the board for allowing me to present. And I'd also like to take this time to thank you for approving phase 1 of the Wissahickon Athletics Health and Safety Plan. By approving that plan, you allowed our student athletes to come in the month of July, and we had numerous teams that came in, and they had an opportunity to work with their team, get mentored and coached by their coaches, and had just a chance to develop both socially and emotionally and as part of a team. And it was really a nice return to normalcy, so to speak, to see these kids out there working together. So thank you for that. While we went and while we did the workouts, I'm trying to move, there we go. We did vigorously screen all of our student athletes prior to them getting on the field. And we put in a number of safety guidelines, working with Dr. Fiddler at Abington Hospital, just to make sure that before we did anything, we were going to, as best we could, educate our students on COVID and also educate them on how it spreads and how to mitigate the spread of that. So a lot of social distancing was used, a lot of hand sanitizer, and teaching kids how to wash their hands, and everything that we needed to do to make sure that we felt that they were safe there. Prior to getting on the field, each student had to make sure that they and their parents signed an agreement, understanding what the inherent risks were. We also educated all the students on COVID-19, like I said, how it spreads and how to mitigate that spread. We also screen kids using pretty much a 9-question screen and a no-touch thermometer, making sure that prior to coming on the field that they were healthy. I have to share with you, we in-serviced the coaches before, and we made sure that we got the message out. If you are not feeling well, if you are sick, stay home. That was the #1 thing that we were sharing with everybody. These workouts were voluntary, and extracurriculars in nature are voluntary. They are not mandatory. You do not have to take part. And we'll talk a little bit about that later, but we wanted to make sure that we were putting healthy kids out on our practice fields to work out with other healthy kids. So in all of our testing, I'm going to say we probably had 5 or 6 teams that came, hundreds and hundreds of kids that were screened. We only had to exclude 2 students, and that was because their temperature was over the 100.4. And in both cases, they were excluded before they even got onto the field. Parents were contacted, they were isolated, they were picked up, and prior to returning, and both athletes were successfully returned to the practice field, but prior to doing that, they saw a medical professional, a licensed doctor, they returned with a clear bill of health, and they also were out a minimum of 3 days, and they were fever-free without the use of fever-reducing medicine. So these are just some of the things that in phase 1 we kept, and we're committed to keeping in phase 2 if the board allows us to move forward with that. Continued wearing of face coverings to and from. Students were also told they can absolutely wear the face coverings during workouts and during play of games if they want to as well. We have ample supplies for hand sanitizer and also to disinfect our equipment. The only thing we really used in common were balls, but we have the stuff to clean the balls just to make sure that that small chance of transmission doesn't occur through that. We're not sharing any other equipment. No, don't share any clothing, don't share any water, don't share any of that. And all other unnecessary contact is limited. No high fives, fist bumps, any of that stuff. Now, what I'm really asking tonight, in a day in which many recommendations have been made, I'm once again turning to the board to ask you to make a decision. And it's deciding on approving Wissahickons Athletics Health and Safety Plan Phase 2, which essentially means we'd have competition. But more than that, it's deciding to allow our community and our families to be able to make the choice. If you decide to approve this plan, that doesn't necessarily mean we're going to have fall sports. There are many things outside of our control that might take that opportunity away. But if you decide to approve this athletic health and safety plan phase 2, what you're essentially doing is you're empowering our parents to make a choice, to weigh the inherent risks with the inherent rewards. And I'm not a scientist, and I can't tell you the inherent risks of if you contract COVID and what the long-term effects are, but I also can't tell you what the long-term effects are of denying kids a developmental opportunity to develop socially and emotionally and mentally through our sports. That too could have a detrimental effect on children if they don't have that opportunity. And I know we have well-informed parents in our community. I know they love their kids more than anything. That's their greatest resource and our greatest resource as well. And I'm confident that they will make the best decision for their child as to whether or not to participate in an extracurricular activity, something that's voluntary. And I truly believe that. As an athletic department and a school, we are 100% committed to having the safest environment that we possibly can and really putting healthy kids out to compete against healthy kids. And as a member of the Suburban One League, I know that our other rival schools are committed as well, because I sit on weekly meetings in which we share the same athletic health and safety plans, and they have parents who love their kids as much too. So if a parent decides that they want their child to opt out, we will respect and honor every decision, because that decision will be made on if that child has any pre-existing medical conditions. It'll also be made if anybody in the household has pre-existing medical conditions, and a decision by a parent to opt out will not impact that child's future in our athletic programs at all. We're going to honor every decision. So before I go on to the last slide, which is the Suburban One League, I really will make this impassioned plea that you approve this phase 2, to allow our parents to make the best decision for their child to help them develop emotionally and socially. Because as an extension of the classroom, extracurriculars provide so much opportunity for our kids to grow, mature, and develop, and they will teach them lifelong lessons that will last them as long as any lesson they learn in the classroom. With that being said, the Suburban One League, in which 24 schools are a member, met yesterday, and we're committed to having a safe environment to allow our student athletes to develop appropriately. And basically, 23 out of the 24 schools approved to delay the fall start for all sports, with the exception of football. That will be delayed for 4 weeks. So a 2-week delay for all fall sports, just to make sure that we have everything in place that we need to safely bring our student athletes together, and then a 4-week delay for football. What that also means is that that's a modified schedule. So games are cut down, and it probably is going to look like mostly just playing your league opponents that are in Montgomery and Bucks County, not traveling outside of those. Many of the non-league games will most likely be canceled. And honestly, that's probably a good thing, because I have a confidence level in the Suburban One League and the ADs and principals that are there, that unfortunately, without working in other leagues, I might not have that same confidence level in them. So with that being said, once again, thank you so much for this opportunity to present, and any questions you may have.
Jim, I have a question. The 23 other schools in Suburban One that are voted for this, these are schools that may be completely virtual right now, or maybe hybrid, but no matter what, they were talking about doing the sports. Is that correct?
Yes, from an AD and principal standpoint, in conversations with their superintendent, they are committed to that. Obviously, they all have respective school boards that they need to go back to and make a similar presentation and get approved.
So this has to be approved by their school boards first.
Yes.
Okay.
I did have a question. So obviously you're the AD, but you also work with clubs. Does this mean that clubs are going to be able to meet as well?
So my hope is, as best we can, the answer would be yes. Right now, we're coming up with comprehensive plans with our club advisors to make sure that we're ready for them virtually. I also have to keep in line with what the governor says for indoor and outdoor attendance. So that could, hamstring us, so to speak, with some club meetings. But we're going to be as creative as possible, because, Paige, these developmental opportunities, they're for all extracurricular activities. It's so good to see our kids participating in them. There's so much growth for them. So yes, we want to make it possible, and we'll do everything we can to be creative to hope and safely do it.
Love that. Because I do play a sport, and I have all 4 years, or going to be hopefully 4 years. So that's very important to me. My last question is, will masks be required during games? And what about sports that you cannot wear a mask, such as sports in the pool?
Okay, so right now the guidance on that from the State Department of Health and everything is masks are supposed to be worn to and from, and even on the sidelines when you're not in competition. They do allow you to take the masks off during play and competition, but there's also the option that if some students feel comfortable wearing the mask, they still can. If you had a chance to catch any maybe Major League Baseball games, you'll see some players wearing a mask, some not. That's going to be a choice, if possible, that student athletes could make.
Great, thank you.
Ron?
Yeah. If you are going to another school for a game, what's transportation going to be looking like? Are you going to do social distancing inside the bus? Are you going to do more buses than usual?
So I'll work with Wade in our transportation department on that. We might also even look at some outside of the box things if parents can transport their kids. But yes, to and from games and competitions, we're going to be as socially distant as possible, wearing masks, making sure that our kids are safe and healthy. Like I said, a vote for this athletic health and safety plan phase 2 doesn't necessarily mean we're going to have a fall season, but we will do everything in our power in practices, in transportation to and from, to make sure that our kids are safe, they're not contracting this virus, and that we can have a season.
Yeah, my answer is a little bit different. And my answer would be pretty much no. We are not going to be able to socially distance on the bus, and we will not have additional buses that are going to be available to us. It's very, very unlikely because we're going to have trouble keeping our transportation system up and operational regardless. And these events happening at the end of the day are going to be directly in conflict with what we're trying to do. So pulling out additional buses to accomplish, transport to other schools is going to be nearly impossible. And again, just, it would be a little bit ironic to require socially distancing on a vehicle, and then as soon as the sport event occurs that we aren't. So I don't think it's realistic to put that into play.
Well, here's my question on that, Wade. When you're on the field, just say football. So when you're on the field with football, you might not be standing next to the same person for a great length of time, right? So if you're an offensive lineman, so maybe you're at the other offensive lineman, from the other school for a couple of seconds each play or whatever it is. But if you're on the bus and you're traveling 40 minutes, then you might actually be sitting or with somebody. So I would think that we would want to take as many precautions as we can.
Yeah, I'm with you, Tracy. I'm telling you, it is very unlikely to happen.
The buses are unlikely to happen?
We are not going to. So how many buses do we currently need to go to a football game, Jim?
Typically, we would have 2 for the team, 1 for the band and the cheerleaders. Speaking.
Right. And so say the same thing for soccer. How many buses would we need for soccer?
Typically, we take 1 bus. There are things that we can do to look at as far as roster sizes, maybe staggering varsity and JV, home and away, to limit that.
Yeah. So in general, the answer is going to be if the requirement is to either find double or triple the number of buses, I am telling you it is very, very unlikely to happen.
Yeah, but I think if we wanted to, if the band is all on 1 bus, and I don't know how many band members we have this year, but if it's a crowded bus, maybe we add another bus that maybe some of the football players could be on there, just to spread kids a little bit thinner than would normally be. That's all.
Mm-hmm.
I'm not saying we have to order triple the buses, but I think we could spread it out a little bit more.
Jim, or actually Jim Crisfield, what do you support this plan as presented by the other Jim? Or, it sounds like Wade has some reservations. So I guess I'm wondering, does this plan have the support of you as a superintendent?
I don't think I'm going to issue a recommendation on this one. It doesn't feel like that's a winning idea at this point. So I will follow Jim Cairns's wisdom and enthusiasm and his impassioned plea, if you will.
I have one other comment that I wanted to make. So I'm going to go back to spring and the sports that were being played in the spring. So I know a spring sport player who was, before school closed, very healthy. When school closed and his sports season was canceled, he then lost, 38, 40 pounds, falling into what I would consider maybe a depression. So I just want to put that out there, that these kids that are playing athletics get more from athletics than just playing on a football field. It is as well as a physical part of their life. It's a mental part of their life. And I just wanted to make that sure that that is out there, that people realize that when we talk about athletics, it's not just about, oh, the kids that are running around playing whatever sport on the field. Like, this is a part of their personality. This is a part of their life. Just want to throw that out there.
As far as going back to competitions, are there going to be restrictions? You mentioned parents driving players, but will there be limits on spectators or no spectators if there's happens to be a contest? Do you know?
Right now, the governor says there will be no spectators in any of our competitions. We're currently, and today we installed 2 cameras that have live stream capabilities that our community could watch if events are in the Circle Gym, the Natatorium, and the stadium. But there will be no fans in any sports competitions until the governor changes that.
I have a severe problem if we're going to be transporting our kids jammed into a bus where we wouldn't let our kids during the school day travel in. If there's no adjustment for the buses, either for the booster team organization paying for them, or the I'd be willing to perhaps shift some money in from our budget into paying for the extra buses, because I think you're really looking at a very dangerous situation by jamming kids into the buses the way they are, knowing especially how the kids are after the game. Social distancing is not even going to be in their wildest imaginations. And I think either we supply the extra buses or somehow, or we can't do it.
Just to be clear, there will be no jamming kids in the buses. It would be unsafe, and I wouldn't stand for that. If we needed to reduce rosters, if we needed to look at home and away for JV and varsity, if we needed to just remove sub-varsity teams and only have that, I'd be willing to make whatever modification is needed to make sure that we can safely put our student athletes out there to compete. And I'd work with Wade. I know we have constraints. I will work within any constraint we need to make sure that our student athletes and our staff are safe.
Well, would you be able to do the same way we're talking about in our hybrid schools, 1 kid on a bench?
So again, I sincerely appreciate what Jim said, and I believe what Jim said. And to Mrs. Walsh's point, I am not saying we aren't going to try. What I am going to say is that it is going to be extremely difficult, and I don't think that we can have an expectation to do everything the same way we would have, say, last fall, with the ability to socially distance on a bus. It isn't likely to happen unless, as Mr. Cairns points out, we severely change. If he says that that's what we're going to do, then I trust that that's something that we would do. Ron, I will try to find additional buses, but I am probably more concerned about making sure that the transportation system works for the regular day school than I am for the athletics. And I think the athletics is going to be difficult to pull off.
Seems to me the reason we're having all these problems with buses and what to do is because there's a pandemic. People are dying, people are sick. That's why we're having this issue. We're really going to worry about, my son was an athlete at Wissahickon. We're going to worry about whether they can play football when the colleges have stopped their competitions. There's a pandemic. We can't do things like
They haven't stopped their competitions yet.
A lot of schools have.
But a lot of them are still doing it. Maybe not traveling, but they're still doing it.
Check that, Tracy.
And I would say that being a parent, if it was a choice of my kid being able to play a sport I would find a way to drive my kid to that sport if that's what needed to be done. And I'm sure as heck, if I would have talked to anybody on the teams that my son was on, they would have said the same exact thing. There's no way that they would not have carpooled in order to make it happen for their kids.
Jim, how are we managing locker room capacity? I played sports every season of my time at the middle school and the high school. And typically we did have some concerns at that time just with capacity in locker rooms. How are you managing that now? And how can we make that a safe environment?
So as Wade alluded to, it would be a new normal, and we couldn't expect to do things the way that we did in previous falls or previous seasons. There's a very strong likelihood that we wouldn't have any use of the locker rooms to keep kids safe. We'd require them. There's really two sports that have the equipment, the field hockey and football, more so field hockey goalie equipment. We'd require them to take the equipment home and clean it, sanitize it like they typically did growing up and playing youth sports all the way along. So I would err on the side of caution and not give access to our locker rooms.
How would athletes get changed after school in order to participate?
That's a good question. I was actually going off the mindset that it would be online learning. What we would have to do is we would have to keep them socially distant in locker rooms then. We would have to have staggered times for kids to enter, make sure that it was clearly delineated 6 feet apart or more. We would have to take that type of approach if they couldn't already be dressed and ready to go for their sport.
You feel like you could do that on a consistent basis? I mean, I'm deferring to your judgment, but I mean, it would be difficult to achieve. I'm just wondering what the plan would be.
Honestly, with the amount of time that we have to the start of the season, I do feel confident that we could do it. I can't reiterate enough. If I feel like we're not putting our kids in a safe environment and our staff in a safe environment, we're not going to do it. So the vote today for the board to, if you did approve phase 2 of the Wissahickon School District Athletics Health and Safety Plan, it's just really empowering parents with choice to decide what they want to do. At the end of the day, if we feel like we can't do it safely, we're not going to do it. I promise you that.
So Jim, then if, as Wade is kind of implying, you only have one bus and you have too many kids to go to the football game, you would either come up with alternative transportation plans or cancel or forfeit that game? Is that what you're saying?
No, what I'm saying is we would know that going in, and we would have a decreased roster size that we would be bringing if we couldn't put them on the bus safely or have them transported by parents.
So you would come out, you would get creative and do whatever you could to maintain the health guidelines, social distancing, and other restrictions to keep the kids safe.
Yes, kind of like what we've been doing in phase 1. And honestly, I know we talked about data. I have just raw local data that says what we've been doing has been working. I spoke about the 2 exclusions that we had, and that was probably with hundreds of kids that we screened. And I know our community, our coaches, our student athletes want to have a season. So they are willing to do what it takes to stay safe.
And Jim, the 2 exclusions you referred to, my recollection is that they had fevers and it turned out it was not COVID-19, it was just something else. Is that correct? Okay. Any other questions for Jim about the plan? Okay, so
I'm sorry, Joe, I couldn't hit the mute button quick enough. Just one question regarding to the testing. Is the requirement if a student or athlete rather is displaying symptoms, is the criteria for them to return 1 test that's negative in a 3-day period? Am I correct?
So that I would refer to the Montgomery County Health on that. when we talked to our solicitor and we talked to Dr. Fiddler to consult, the decision was if anybody was exhibiting symptoms that was excluded, they would have to see a licensed medical professional. And Dr. Fiddler and our solicitor felt strongly that that professional would require them to have testing. I believe if, you know what, I'd have to get back to you on it. If they test positive, I believe it's 10 days out that they're quarantined with a 3-day fever-free return. I'd have to check on the negative. And also, if they've already disclosed that they're around somebody with COVID, I believe they're out for a 14-day period as well. But as for the negative testing, I'd have to get back to you on that.
And so, but there is no requirement then for them to have a doctor's note clearing them to come back.
No, I'm sorry. They definitely have to have a doctor's note to return.
Okay. Okay, thank you.
Any more questions for Jim?
I did have a question. So
Okay.
if by the off chance, say I'm playing a sport and I end up testing positive, is there contact tracing if I already played it?
Ron Stoloff, please turn off your video.
Paige, go ahead.
So if by any chance I do happen to test positive and I've already played a game, how is Montgomery County still doing the contact tracing, or is it kind of up to the schools?
Yes. So you would contact the school officials and we would be in contact with Montgomery County Health Department so they could implement contact tracing.
Okay, thank you.
Jim, just quickly, has there been any discussion or consideration of the governor's statement today regarding sports being canceled into 2021?
Yes. So great point. Obviously, at the state level with the governor and the PIAA, there is still talk going on as to what they're going to do with the fall season. I kind of alluded to that a vote today in favor of phase 2 doesn't necessarily mean that we will have a fall season. There are many things that are outside of our charge that could be changed, and that could be one of them. But what it does allow us to do, if the PIAA is going to move forward with the fall season, it allows our parents the choice to decide whether or not they would like their kid to take part in a voluntary activity.
And are they having a meeting tomorrow?
The PIAA will have another meeting tomorrow, and they're supposed to come out with a statement tomorrow as well.
Any thought of waiting until that is done before you make a decision?
So there was discussion to that. And it was decided that we, make the presentation today, knowing full well that if the PIAA says they're going to move the season, then we will honor the PIAA and we will not have fall sports.
So Jim, just to be crystal clear on this, if we end up approving your plan today, but then tomorrow the PIAA agrees with Governor Wolf's strong recommendation to cancel fall sports, we would also cancel fall sports in line with the PIAA.
Absolutely.
Okay. All right. There was one comment that was submitted regarding the athletics, and it is from Sarah Bowman, and it reads as follows. I know you are voting on a 100% virtual plan to start the year today, but in the event that this plan does not pass, I would like to address the current plan regarding school sports. Why are we allowing contact sports to be played? We are correctly taking extreme action to keep schools safe by having kids go to school every other day, keeping them 6 feet apart, and having them wear masks at all times. But we're going to allow football players to tackle each other without masks, and they continue to be a part of the general school population every day. Professional sports teams have not been able to stop the spread of COVID-19 within their organizations, even in more socially distant sports like baseball. Why would a public school with far fewer resources be able to manage it when professional teams have not? Chorus has already been canceled due to the high risk nature of singing. Why should sports be any different? Allowing contact sports to be played seemed like a hugely irresponsible and short-sighted decision. I keep hearing that you are following the PIAA guidelines, but there is no information explaining the PIAA's decision-making process or why this is considered safe. I don't understand why we feel bound to the PIAA's decision in the first place. I read the governor's order regarding sports, which states that some sports are definitely considered more high risk than others. It also says that individual schools can make their own decisions regarding sports. Why has Wissahickon not made safety our first priority? It seems like every other precaution we are taking could be for nothing if we allow some kids to engage in very high risk activities that could likely cause an outbreak within the school. These decisions could literally put lives in danger in multi-generational households like mine. With so many local districts moving to 100% virtual, will there be any other teams to play? I implore you to please consider the health and welfare of Wissahickon students, their families, and the greater community, and at a minimum cancel contact sports for the fall. I truly do not understand the reasoning behind these sports even being considered at this point. And that was the only comment submitted for athletics. So with that, I think similar to what we did with the fall reopening plan, I think we should just go to a motion for approval of the WSD Athletic Health and Safety Plan Phase 2, dated August 6th, 2020 per document 6-2. I'll ask for a motion.
So moved.
Second.
The motion has been moved and seconded. Any final comments or questions about the item? Okay. Wade, can you please conduct a roll call vote?
Sure. Was it Zephy who seconded?
Yes.
Thank you. Mr. Badger,
Yes.
Mr. Bleefeld,
No.
Mr. Frank,
Yes.
Mrs. Hayman,
No.
Mrs. Karyanikes,
Yes.
Mr. Stoloff, Mrs. Walsh,
Yes.
Mr. Antonio.
Yes.
Motion passes 5-2.
Thank you. Okay, but those are the two voting items that we have for this evening. We have one other item, an informational item from Jim in the superintendent's report, a no less important one, but Jim, do you want to cover that, please?
Yes, thank you. So we are able to report on give an update on the subject of racial justice and cultural responsiveness and the various different things that are taking place to address that. We are in this forum, we've heard from people on the topic, and we received a petition with many signatures and a list of there were demands of things, about 10 specific things. So I'm going to address the 10 things and actually share a little bit about what's happening with each one. And I think it's easiest to chunk the 10 things into 3 different areas so that we can kind of grasp where we're going with these things. The first topic on, or I should say, at least at the top of the list, was something that we had already been working on, which is a professional development and training commitment that gets at how people treat each other and gets at biases that people may have, unintentional, maybe not even knowing it, when it comes to having conversations with people who are different than you, conversations about race, conversations about what might be happening in the world, saying things or doing things that are offensive. Like I say, not even intentional necessarily, but all these things need to be identified. Mindsets need to be challenged and changed. We so on that front, we are engaging a consultant to help us put together a plan, a multi-year major initiative that will start first with adults and also eventually get to students. And it's just going to be a really well done, professional, long-term, sustained conversation, essentially, that involves professional training, professional development for all staff members. Board members will be included. Students will be included as well. And I think it's time that, or I should say, given the time that we're in and commitment we'll have to this, I do feel very good that systemic change can happen, but it's not going to happen overnight. And that's why this is a multi-year commitment to the notion of mindset examinations and adjustments. The second batch of things that were brought up as requested or demands have to do with curriculum or programs. So, and they're important as well. So we will do an I should say, a rather comprehensive review of all curricula to make sure they are inclusive, to make sure nothing in there is discriminatory or offensive or in any way inappropriate. And then the program pieces are things like the gifted program or AP enrollment or special education or discipline of students. And the call was to see if there's anything amiss there, any hurdles or barriers or unfair things at work that discriminate against a certain group of students. If we find any, we certainly will look at all those curriculum and program areas, very, very important. And if we find something, we will certainly change it. And then the last batch or a kind of like chunk of area would be personnel. There was a request to increase the diversity of our staff so that it better mirrors our student body. And we feel that is very, very important. We know that a staff that does mirror a student body means that the students see role models, students of all colors see role models, and it's just a better, more natural environment. So we have made it our business to go to great lengths to hire both certificated or teachers of color, but also support staff. And at the August 24th, I think it is, board meeting, yeah, Monday the 24th, we'll have an update on the professional development plan, training, and also on our new incoming group of teachers. And if they self-report in one way or another, we'll categorize all that and share it out. I think you'll see we've done a good job of improving the diversity. And that is another thing. It's not going to happen overnight. If a teaching staff of 300 members say, needs more of a particular group, we just need to have a concerted effort to make that happen over time, which we will. The other piece of it, the chunk of the staffing piece had to do with the hiring of an equity coordinator or a director of equity or something like that. That's a little bigger piece that will have to be considered by the board, and the board can make that decision at budget time. We did not budget for that, but we will certainly make a point of including it in the budget deliberations. It's really kind of hard to believe that those will be coming in a couple of months, but they will. And we can consider the funding of that at that time. So that's an update on the list of things that were shared with us that we are going to pay attention to. There's another piece here, and I'll let the board members speak to this. There's a new board committee in the formation stage. Doesn't even really have a name yet, but its purpose is an oversight, a racial justice or a cultural responsive oversight committee. Again, name's not clear, but I will leave that to the board to present as an update.
Hey, Jim, I have one question. Can you compile data for the personnel part of it, like the percentages of, the different makeups that we have and where we are lacking?
Absolutely.
Like where we have to really concentrate.
Yes.
I don't want to say lacking, but where we have to really concentrate. And I think it's a great idea of having this board committee. And I think, we'll be able to monitor things. We'll be able to give input. We'll be able to, make sure that the community has a voice and is heard. And I really look forward. I think this committee is going to be a really good committee, and we're going to learn a lot. And I think we'll be able to do a lot.
I agree with Tracy's points. Jim, first of all, I think it's great initiative, a great start with where you're headed in looking at the list of demands that we've received and examining them point by point. I also think that is work for the committee that we've discussed. It came out of a concept that I thought about last year and that I had a chance to talk briefly with Jim about a year ago. And it is absolutely necessary and timely to do so now. Part of the reasoning is that, as Tracy said, we really need to get input from a broad set of stakeholders within our communities. That includes students, it includes faculty, the administration, the board, other major groups with a voice within our community, as well as parents, to all be a part and to be able to voice their opinions, voice their experiences. One, so that we can really help to identify and pinpoint where our problems are, but just as importantly, to have an ongoing effort to find solutions. When I walk the halls of Wissahickon, and I've said this before, some of the same circumstances existed when I was there, and we dealt with things that occurred during my time. They stemmed far before my tenure at Wissahickon, and they continue to this day. And while the challenges and some of the issues that we faced may have been different and may have evolved, the fact that they still exist in 2020 is unacceptable and really need to be addressed on a consistent and ongoing basis. And I think this committee allows for that. The sense of timing and urgency is important and needs to be now. But my hope and my goal, and I appreciate the support from everyone who has weighed in and been 100% on board with this, from the board to the administration, is to have this be an ongoing standing effort. Because when the headlines go away and when things go back to somewhat of a quote unquote sense of normalcy, I don't want this issue or topic to fade, as I know no one else does. And so the committee is one way to do that and to have sustained input. But I really think it can also help form a broad set of ideas, of concepts, of solutions that we can bring collectively that we cannot do monolithically. So it's unfair to say that the administration should try to come up with all the solutions or any one group of us. It's going to really take a collective effort because we should all have a sense of responsibility because it does affect all of us in one way or another. So I'm proud of the district for taking this step. I'm very much looking forward to playing an integral part of trying to help to put it together and play an active role. And I've received an incredible amount of requests, people asking, how can we get involved? What can we do from the board, from the community, from different groups of alumni, as well as current students. So again, I just wanted to frame that for everyone who has not been aware, but I'm very excited about it and hope to get a broad base of support to continue to move forward.
Yeah, Paul, I love the idea, and thank you for taking the initiative and pushing this forward with Jim. What I love is that we are trying to take this moment in time and kind of the urgency around this issue to do something and put something in place that will hopefully be long lasting and help hold us as a board as well as administration accountable for producing some positive change and results. Not just to reduce the more obvious sort of manifestations of racism in terms of language or attitudes towards people, but some of the more, I think, insidious and deep-rooted signs of racism that we have in our district that were alluded to by the student group at their recent event, and I think other people have pointed to. The fact that we have a woeful underrepresentation of Black and Hispanic students in gifted. The fact that we have a huge disparity in the amount of Black and Brown students that graduate having taken a single AP course from Wissahickon High School. Those are things that I believe are the result of racist policies, practices, attitudes, and beliefs that are embedded in the system of education that we have. And that to me is going to be the tougher nut to crack, the one that's worthy of our attention and our effort. And I'm excited about this idea of an oversight committee that's not just board people and administration people, but also includes, as you said, Paul, parents, students, alumni, other community advocates to help hold us all accountable for not just like talking about changing things, but actually making some positive changes that change some of the inequities that exist and have existed for a long time. So again, thanks for kind of pushing the issue with us. And I look forward to getting this thing up and running to make what will be, I think, a long-term effort to try to finally address some of the racial inequities that have been in Wissahickon for a long time. And Wissahickon's not alone, but that doesn't excuse us from trying to address it within our boundaries and within what's our area of control. So again, thanks, and I'm excited to move forward on this journey with you and everyone to try to make a positive change. Thanks. Okay, so let's see. Next up is our second public comment period. And during the course of the meeting, we've had a flurry of emails continue to come in. Wade, I don't know if anyone was trying to take a tabulation of like the first 5 that came in after the presentations. Wade, you're on mute. Wade.
I did do that. Do you want me to read them? Do you want me to send it to you?
I would appreciate it if you would take the honors of reading them. My voice tends to cut out reading those comments, and I've spoken too much tonight.
All right, so I just took the first 5 after the meeting started. This first one is from Amy Sills. Thank you for all you've had to endure the last few weeks. I'm looking forward to a comprehensive virtual plan and schedule being released soon so families can try and have enough time to plan. I am also asking you to consider the fact that the Wissahickon community, especially those with elementary students, have been trying to plan for virtual learning for weeks. We have been working at lightning speed, taking matters into our own hands to ensure working families, single parents, and those who need help with childcare who chose virtual learning can share the load with other families. We are helping each other. I hope you will also consider these small groups that are forming an important part of a successful year. Yes, they can become a way to make this crazy situation even more inequitable. But it could also be a short-term problem solver for many families, both privileged and not so privileged. In Ambler Borough, where I live, we have many very tight-knit community. We have a very tight-knit community that finds solutions and works to help each other. I hope you will consider and attempt to keep some of these little groups forming together if they are in the same grade and school. I believe it will be beneficial to the community, to the teacher, to the students, both educationally and emotionally, as well as for the parents. This will only work well if kids are watching the same teacher and a family/parent/hired help is able to help with the kids with the same teacher. If the school can help some small pods form, if we do go 100% virtual, even better. I know that this is not the way you normally do things in regards to class lists and planning, but I do think that this is a unique time with unique challenges, and all of us pitching together to help each other is the only way many of us will be able to get through this time. Please consider allowing small groups to be requested to be in a class together. Thank you. Dear Wissahickon School Board members, if there will not be a need to coordinate busing for the start of the school year, I would like to suggest that the school day for middle school and high school begin at 8:30 a.m. to better meet the sleep requirements of adolescent students, and that's from Ralph Insignia. Thank you to the superintendent and the board for the careful consideration of the options to educate our children. I would like to express a unique point of view in that we have one son who experienced the virtual option proposed, so I am fully aware of what this experience is. I chose hybrid not because I was comfortable of an in-person education. I am not, but I do not understand why we can't do virtual synchronous until it is clear that we have effective safety measures. Right now, the safety measures are experiments at best, and leading indicators are that they do not work. In areas with substantially lower viral load than we have, I don't want our children to be experiments. It is unethical. I do not understand why we can't shift to virtual synchronous. I want our last son in the Wissahickon School District to have his Wissahickon teachers, not the virtual program teachers. Thank you for your consideration, Julia Wagner. Good evening. I am a registered nurse and I have seen the effect of COVID-19 firsthand. In my professional opinion, I do strongly believe that it is best for the board to vote in favor of Dr. Crisfield's recommendations. There are so many uncertainties and the functionality of the school should really rethink and refocus the plan to consider the 100% virtual option. I am so very glad that Marshall voiced concern at the last meeting because as a medical professional, I would have to say that there is no safe plan in place that the children, teachers, faculty, and administration back to school. Daycare centers are smaller facilities and may be able to safely function with adequate precautions. However, schools are as large as Wissahickon are unable to safely do so. I beg for you all to reconsider. I am willing to provide medical feedback if necessary. Ms. Hines. And the last comment, I would like to ask how many cleaning supplies have been procured, not on order, actually on hand for the year by Wissahickon. A neighboring district was honest with the community and advised them that they only had procured 1 month's supply of cleaning supplies. As all the schools in the US are fighting for the same supplies, where do we stand? We've already seen a student in another state being sent to school while he was awaiting test results. How can you ensure parents won't do the same here? Thank you, Nicole Steitler, Steitler. And that's the end of that. You're muted, Joe.
I'm sorry. Any comments from board members? Okay, I know it's been a long night, another long night. Appreciate everyone sticking with us. The decisions obviously before us are terrible ones and difficult ones to make. I appreciate everyone's willingness to engage and voting basically with their heart and what they think is right and best. We are a board of 9 members. We are 9 individuals. We're allowed to have different perspectives and opinions, and clearly from tonight and previous meetings, you can see that we do. But in the end, majority rules, and based on the vote of the board as a body, that's what we are going to move forward with. And I want us to do everything that we can to support the superintendent, the administration, and the staff to successfully implement what the board has approved. And I think we all know and will expect to be vigilant and remain flexible to adapt and make whatever changes are necessary if conditions change as we move forward. And with that, can I have
one thing that I wanted to add. I think that maybe, I don't know, since we're doing the hybrid, if we could possibly look at, some of the other schools that have been running with the hybrid from the very beginning and focusing all their energy there. I know like O&J Roberts has been in it from the beginning. I was talking to one of the board members there, and she was telling me, they have been planning for the hybrid from day one. So I don't know, they might be a little bit further along the road than us, maybe have some different ideas that can be bounced off. I was talking to one of the administrators there today, and they offered any assistance that if we had any questions, they were more than happy to talk to anybody in our administration. So I just wanted to throw that out there and, know that other people are out there doing the same thing. So we might not have to create a wheel instead of recreating it. We might not have to create the wheel, but maybe look at what some other districts that are doing this hybrid are doing.
I do have one quick comment. I just wanted to thank everyone involved here. As was stated, there are no perfect answers, really no right answers here. It's just a matter of trying to pick the path that helps mitigate risk and help as many families with all differing needs as possible. It's an impossible task, but I know the administration worked extremely hard throughout this entire process. The parents, the community, the hundreds of letters and emails rather that we've received. Everyone has very passionate and sincere views on both sides. And I just wanted to thank everybody, the board as well, for all of the hard work that everyone has put into this very difficult decision.
Thanks.
I would second that. I'm thanking the administration. I'm sure it's exhausting day in and day out to wrestle with this issue. There are no good answers. And I really appreciate everything you've done. Thanks.
I feel the same way. I just want everybody to stay safe and be healthy as we go forward.
Anyone else? Okay, then can I have a motion to adjourn the meeting?
So moved.
Second.
Second.
All those in favor say aye.
Aye.
Aye. Meeting adjourned. Thank you, everyone.
Thank
Have a
you.
good
Good night,
night.
everybody.
Thank you all.
Good
Good
night.
night.